o'clock. We do have the county commissioners meeting first, but I can open the meeting with the script to save Christy from doing it because she probably doesn't have it right in front of her. We are using Zoom webinar for meetings, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click their raise the hand button if they wish to speak. The chair will call on those who have raised their hands in the order in which they were raised. As a preliminary matter, I'm Dawn Holgate, Chair of the Nantucket Select Board. Permit me to confirm that all members and persons anticipated on both of our agendas for this evening are present and can hear me. Select Board and County Commissioner members, Jason Bridges.
Here.
Matt Fee.
Here.
Melissa Murphy.
Here.
Christy Ferrantella.
Here.
Thank you. Town of Nantucket staff members, Ken Beaugrand.
Here.
Kathy Flynn.
Present.
Erica Mooney.
Present.
Libby Gibson.
Present.
Brian Turbot.
Present.
Tucker Holland.
Present.
Jericho Mealy.
Present.
David Gray.
Present.
Okay, and then we do have a few others with us this evening. Dr. Diane Pearl.
Present, thank you.
Gary Shaw.
Present.
Lisa Getter. Frank Shad.
I'm here.
Tim Carruthers. Richard Hussey. Valerie Oliver. I think that people have muted and probably walked away because they're not for a while.
Present.
On our agenda.
Richard Hussey here.
Oh, thanks, Richard. I see Roberto Santa Maria just joined us as well. Good
Present.
evening, Roberto. All supporting materials that have been provided to members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. This meeting is being recorded and all attendees are participating by video conference. Accordingly, please be aware that folks may be able to see you and to take care not to share the screen of your computer unless you intend to. Anything that you broadcast may be captured by the recording. The chair of each agenda this evening will introduce the speakers on the agenda. After they conclude their remarks, people can raise their hands for questions or comments. Please remember to keep your phone or computer muted when you are not speaking, and please remember to speak clearly in a way that helps generate accurate minutes. And when we're not on your agenda item, it may be better for people to keep their cameras off. And if you wish to engage in conversation with other members, please do so through the chair, taking care to identify yourself. And finally, each vote will be taken by a roll call. And with that, I will not call the select board portion of the meeting to order and turn it over to Christy Ferrantella, who is the chair of the county commissioners.
Thank you, Dawn. So I'll call to order the county commissioners meeting for January 27th, 2021 at 5:04 p.m. We'll accept the agenda as written and the announcements. The county commissioner meeting is being audio and video recorded. The next item on the agenda is public comment. This is for anything not on the county commissioner's agenda. If you have a public comment, you can raise your hand and we can accept those throughout the meeting. I know there's a little bit of a lag. So I'll move on to no new business and moving on to approval of minutes and warrants. Is there a motion to approve the minutes, payroll, and treasury warrants?
So moved.
Oh, second. Okay, by roll call vote, Jason Bridges,
Yes.
Melissa Murphy,
Aye.
Matt Fee,
Aye.
Dawn Holgate,
Aye.
Christy Ferrantella, aye. That passes unanimously. The next item on our agenda is request for approval and execution of license agreement with Nantucket Islands Land Bank to use portion of parking easement land located at Hoyks Hollow Road granted to the county by Sankaty Head Golf Club for public parking for Coast to Coast Trail and to fence in the easement area and install signage for Coast to Coast Trail.
Thank you, Madam Chair. The Land Bank is creating an island-wide trail that they're calling the Coast to Coast Trail. And it's being done in conjunction with Massachusetts Audubon and the Nantucket Land Council. And this site would be the eastern end or the start of the trail from this part of the island. Sankaty Head Golf Club granted an easement for this portion of their property to the county in 2002. And what this license is a license that runs for a 5-year period to the land bank to be able to utilize this space. They're required to take care of it, maintain it, and manage all the expenses of it. The license can be looked at the end of the 5 years and renewed for additional 5-year terms. I think this is something that is really a terrific benefit to the community. And the license has been drafted by and reviewed by town council. And so it's my recommendation as staff that the county commissioners move forward and approve the execution of the license. Be happy to answer any questions.
Thank you, Ken. Are there any questions? Matt,
I'll move approval. I think it's great.
Second.
seconded by Dawn. By roll call vote, Dawn Holgate,
Aye.
Matt Fee,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
Christy Ferrantella, aye. That passes unanimously. Thank you, Ken. The next item on our agenda is the review and adoption of FY 2022 county budget. Turn this over to Brian. Brian, you're on mute.
Sorry about that. Next slide, Erica. Thank you. So the county is made up of three particular items: the county administration and the registry of deeds, which is split into the administration and deeds excise. Next slide, please, Erica. Thank you. The revenue sources come from the town assessment, deeds excise revenue, recording fees, corrections deeds excise, which is the $250,000, which is committed to the public safety facility for a portion of the debt service, and either of the two fund balances being registry of deeds excise fund balance, which is limited to only being used for registry of particular items, or the county fund balance, should that be needed to be utilized. Next slide, please, Erica. For fiscal 22, in working with the registrar, Jen Ferrera, we have come up with the majority of the revenue projections here. Town assessment has gone from the 170,201 that we have typically been able to maintain for the past few years to $174,455. Deeds excise receipts are projected to be $478,125, split between county administration of $286,875 and the registry of deeds of $191,250, with recording fees being $171,500, and the corrections deeds excise, which I mentioned on the previous slide, of $250, which funds a portion of the debt service for the public safety facility. Total projected revenue, if all of these were to be reached in our projections, $1,074,180. Erica, next slide, please. Thank you. So the county funding requirement, which is also known as maintenance of effort, by law requires us to provide a certain amount of non-deeds excise revenue to the county every year. That amount increases by 2.5% per year. The funding requirement this year is $346,000. Go ahead. Next slide, Erica. Sorry. Projected expenses for fiscal 22, county administration, which has no employees, has remained constant as it was last year of $258,984. Most of the expenses within the county are relative to any potential legal expenses that we may need throughout the year. Registry of Deeds, $511,234. The Registry of Deeds does maintain three full-time employees and has some deeds, excise, and special projects, as well as administrative expenses that it pays for out of that $511,000. And then the Public Safety Facility Debt Service contribution of $250,000 gives us a projected total expenses of $1,020,218. Next slide, please, Erica. Thank you. So you can see the comparison to the budget. As I mentioned, county administration did change by $20, I think is what it was there. Payroll went up from 403,000 to 416. That's staff raises that are contractual, as well as projected increases in health insurance. Operating expenses moved up slightly based on prior actuals for the registry. Total there is 465,000 versus the 448,750 for fiscal 21. Deeds excise, the registrar does have some additional projects that may have to be undertaken this year, so we have increased the deeds excise expenses from 37,760 to 45,952. Total Registry of Deeds budget of 511,234. I would like to mention on the one that was sent out to you, inadvertently left off the deeds excise total and had the total registry budget in that line item for the presentation. We did correct it, so it is showing as correct to you tonight. The public safety debt of 250,000, total county budget $1,020,218. Next slide, please, Erica. The next steps, we will be, after presentation to the county commissioners tonight, we will bring this to the Nantucket County Review Committee, also known as the Finance Committee. That meeting actually was scheduled for the 2nd, but has been moved to February 4th. There's no meeting on the 2nd, so we'll be bringing this to them on February 4th. Next slide. And I'll be happy to answer any questions if any of you have any.
Thank you, Brian. Are there any questions? Not seeing any. You need a motion to adopt from the county commissioners.
Yes, please.
Okay, is there a motion?
So moved.
Second.
Thank you. And by roll call vote, Don Holgate,
Aye.
Matt Fee,
Aye.
Jason Bridges,
Aye.
Melissa Murphy,
Aye.
and Christy Ferrantella, aye. That passes unanimously. Thank you, Brian.
Thank you very much.
Are there any commissioners' reports or comments? Seeing none, I also see no hands for public comment. Is there a motion to adjourn?
So moved.
Second.
By roll call vote, Don Holgate,
Aye.
Matt Fee,
Aye.
Jason Bridges,
Aye.
Melissa Murphy,
Aye.
Christy Ferrantella, aye. That passes unanimously, and I'll pass it back to Dawn for the select board meeting.
Thank you. I'll call the January 27th Select Board meeting to order at 5:13. I think we have one additional announcement to be added to the agenda from Tucker Holland, and but I can turn it over to the town manager to do the other announcements.
Thank you. This meeting is being video and audio recorded, and tomorrow, Thursday, January 28th at 5:30, we have a Nantucket Coastal Resilience Plan Community Open House. It is going to be held on Zoom. The registration information is online, very easy to find, and we hope that we will get a lot of community input. This is specifically targeted to get community input on the Coastal Resilience Plan, so hopefully people will attend. And I believe the housing director has an announcement.
Thank you very much, Libby and Madam Chair. I'd just like to take that opportunity to let the community know about a survey that is available on the Affordable Housing Trust webpage of the town website. This is in conjunction with the Housing Production Plan update. If you go to the Affordable Housing Trust page, you will see links that will take you to either an English, a Spanish, or a Brazilian survey. And we've had roughly 250 responses thus far across all 3 languages. And we are interested to get as many responses from the community as possible. This will be open for the next couple weeks. So please do fill that out when you have a chance. Thank you.
Thank you. Next, we will move on to the COVID-19 weekly update portion of our agenda. I don't see any hands raised. If there are no select board opening comments, I'll turn it over to our public health director, Roberto Santamaria.
Hello, now we'll go ahead and share my screen. Not that, sorry, just a moment. There we go. So every time. There we go. Sorry, now I'm even stuttering because I messed myself up. Where am I? All right, here we go. So the COVID-19, we've been in pretty good shape over the past few days. In the last week, we've had 23,821 tests, 1,102 positives. We still haven't done updated the stop the spread until tomorrow, until next month. So when we had our original explosions of cases, we were seeing, close to 200 cases in a week. So what we've seen from November to just through December to now into January, we saw 113, 102, 60, and now 46. So we're seeing that drop by a good amount every single week now, and we're hoping to maintain that trend so that we can get back to our old normal numbers. And then with the crude death rate that we're seeing, this is crude in that this is total death rate for Barnstable County, Suffolk County, and the state. So you'll notice that it's actually down as well from what they were last week. So we're down by 0.02%. Barnstable County is down by 0.1%. Suffolk is down by 0.03%, I think it is, and the state is down by like 0.02% as well. So it's good news. Everything is on the correct trend line right now. And then as we keep going, the positivity rate as of this 7-day average is 5.8% for over the last 7 days. We're still doing well on the testing capacity, and the contact tracing should be up to date. You'll see that the sewer predictive index has dropped as well to the 15 cases per day. This is last week's sample from last Monday, so it is pretty consistent with what we did see last week. So this is our metrics and the good news about what we're seeing. And then we just checked, and David Gray is letting me know right now that he just checked and they haven't received this week's BioBot test. But as soon as we do, we'll put that up on the website. So you'll see that in the trend of the curve, the good news is in this last section here that I have highlighted is you'll see that the slope of the line is actually kind of flattening out again. And that's exactly what we want to start seeing. We want to start seeing little plateaus. We want to see this fully plateau. So that's exactly what we want to see there. However, over the last 30 days, we are still seeing approximately 300 cases every 30 days or so. But this cannot be much better from what we're seeing here, which is great news. Still consistent population of 1.29 million gallons per day. Same population estimate as we did the week before. But we're seeing this slope go down, which tells us that through a consistent and static population, we are still seeing the concentration or the prevalence of cases go down, which is great news. So from an epidemiological perspective, you want the prevalence to be lower than the incidence, because incidence means that more people are getting sick as they go along, as time goes on. Prevalence means more people are sick as time goes on. So people who are still sick is what the prevalence number is. And what we're seeing is When there's a static population, yet the slope is still trending down, that means that the prevalence is also going down, which means less likelihood of overwhelming our hospital, overwhelming all our infrastructure, things like that. So when we look at the flatten the curve thing, this is that 7-day moving average trend line. It's been staying pretty flat here. So our number, which you'll see here, I didn't put the estimate down because our R number is coming out to around 1. Which is just a 1-to-1 transmission, which is still okay. We're still in great numbers here. We're not at super risk of overwhelming our infrastructure. In comparison to the state, they're around the same thing. They are dialed in to a much higher resolution here. So you'll see that the 0.91 is actually, pretty low to the asymptotic curve, but it is still, for all intents and purposes, 0.09 is basically 1 as well. So we are right in line with the state. We've been getting questions about close contacts. So very first thing, if you are told that you were a close contact, get tested, quarantine. That is the very first thing you should do. The Community Tracing Collaborative should be contacting you, but if you have not received a phone call within 48 hours, you can call them at these 2 numbers that are there. For those listening on the radio, the 2 numbers for the contact Community Tracing Collaboratives is 833-638-1585 or 857-305-2728. And the other thing that we're running into, make sure your voicemail inbox is not full. It happens all the time. You don't pick up the phone because you don't recognize the number. You let it go to voicemail, but you haven't deleted your voicemails for the past 35 days or so. So when it comes time to leave your voicemail, it says this person's inbox is full. So you're never going to call the person back, and you don't know that the person looking for you is the Community Tracing Collaborative. So make sure your inbox is empty, or at least delete 3 or 4 voicemails just to be safe. And then moving forward, still going forward with the vaccination plan. And then we're at the very last step of phase 1. We're the healthcare workers doing non-COVID facing care. That includes we had questions about dentists. We know that the Meals on Wheels volunteers got added to phase 1 in this section. We are adding you as things go. If you haven't filled out the survey for phase 1, go ahead and fill it out for phase 2 as well. If you feel you qualified for phase 1, but please feel free to contact us at health@nantucket-ma.gov. What we are phase 2 is looking to start next week. We were going to be opening our first mass vaccination clinics on Wednesday, a week from today, at the VFW. You should be getting a phone call if you haven't already received a phone call, an email, and/or a text message today. It's telling you to go on to the patient gateway, sign up, and then you'll be able to, if you fit into the 75+ category right now, or if you're one of the still outstanding phase 1 people, you will be getting a phone call. You should be getting a phone call, and you should be getting communication letting you sign up for an appointment to get your vaccine. So keep an eye out for all communications from us. Make sure your email, check your spam folders. Make sure that that our emails aren't going to your spam. We are getting some people saying that they're not receiving the emails, only to find them in their spam later. And then if you have any questions, you can call 508-325-4151. That is the automated line for COVID information, but also our phone numbers haven't changed for years. So you can still call us at the health department. Just because we're telling people to call here doesn't mean you cannot call us. You can also call the hospital lines as well. We are here to help. So we're not relegating everyone to just this one phone line, which is not always monitored. We do update it as much as we can, though. And then if you have any more if you need any more information from the way the state is going, please go to mass.gov for the state vaccination information. All our information is at this QR code or at the town's website. And then the other portions that we're looking out is that the biggest bottleneck among all of this is the state vaccine supply. So keep in mind that even though we have the capacity to be able to give about 1,400 doses per week, if the state only sends us 300 doses, we will only have 300 doses. Moderna is producing their vaccines as quickly as possible, and Pfizer's producing theirs as quickly as possible too. But if we don't get them, we won't be able to give them out. So it's not that we have a stockpile of vaccines somewhere that we're just sitting on. We are pushing them out as soon as we get them. And then with that, I will call it a day, and I will move on to Gary and Jericho.
Thank you, Roberto. We have Dr. Pearl here, and I was hoping that she would be able to just give us a little bit of build on what you talked about related to the cases we're seeing. And she's certainly available throughout this meeting for questions as well. So Dr. Pearl.
I think that Roberto did a fantastic job summarizing the numbers. As far as the human reality, we still are very fortunate to have generally mild cases of COVID-19 on Nantucket. We've had a few hospitalized patients and a few transferred patients, but people in general have been fortunate and are doing very well. Some of the ones who have had the infection will tell you that they don't feel they did very well because it can be a prolonged and serious infection, even for very healthy people. And the ones who've survived and are behind it would never want to have that again. So we are, still very cautious, and everyone in our community is very cautious at this point. So I think the good news is, as Roberto said, the numbers are flattening down, and we have plenty of testing capability. Our lines are getting shorter. The waits are much shorter. And unless we have another surge or potentially the February school vacation, for example, with a lot of travel and mixing with families together, we hope that we will see a flat curve throughout the spring, the rest of the winter and the spring.
Yeah, thank you, Dr. Pearl. Well, I'll just also add that as we look at moving into the vaccine phase, we still are facing a variant or variants that are out there floating around in the world that are causing concern, because if they aren't checked, they have the potential to cause more illness, more hospitalizations, and potentially more bad things. So how those variants get going is when you have large populations of people, large communities that have that virus circulating, they replicate themselves very quickly and change. They're very smart. And that's how we get these variants. How you stop a variant from developing is vaccinating a population so that it can't get a foothold, and it obviously then can't mutate into something else very quickly or at all, and it starts to go away. So vaccines are extremely important. And to that end, and with what Roberto had said about phase 1 and moving into phase 2 of the governor's orders, as you know, we've been doing those vaccines over at the Cottage Hospital. I have to give a shout out to the nursing staff, all those that are involved in doing the vaccines for the hospital, plus the first responders. You never seen bigger smiles on people coming through, getting the vaccines, or the staff providing it. The morale's been extremely high. So thank you. And Michelle Epps, my chief nurse, is the one that's leading that team and building those plans. But we're very pleased to share progress we've made through phase 1 of the state vaccine distribution plan. We've done so ahead of schedule and in record time compared to our peers across the state, and we're very pleased to say that. More than 500 first dose vaccinations have been provided at NCH to those eligible in phase 1. The first tier of phase 2 opens the week of February 1st, as the governor has said, and that starts with individuals 75 years old and above. And our goal is to have everyone in this tier vaccinated within at least 2 weeks. We're excited to share that in partnership with the town, Nantucket Cottage Hospital will be opening a mass vaccination clinic at the VFW facility at 22 New South Road on Wednesday, February 3rd, to begin phase 2 vaccinations of that 75 plus population. The loss of the days from the 1st to the 3rd is simply so that we can receive the allocations of vaccine, get them here, and obviously start giving those. How you get an appointment to get a vaccine is defined in the following. Scheduling through the Mass General MGB Partners Gateway, Mass General Patient Gateway will be open, and that will start Saturday morning, January 30th. How you get your appointment is if you're a Nantucket Cottage Hospital patient and you use the Patient Gateway, you will be contacted via Patient Gateway by email, text, or phone when you become eligible for the vaccine. So please, as Roberto had said, stand by and wait for that communication. Once you are contacted, you will be able to schedule your vaccine appointment in the Patient Gateway platform. So that would be a go in and select and pick a date. And the amount of appointments that are available are only going to be as big as the amount of vaccine that's come in for that particular age group or phase. So we know that there are a number of you obviously that want this vaccine. And so as you go through this process, we hope you're patient because for the first group, those age 75 and above, we anticipate a week and a half to 2 weeks to be able to get those individuals in that population vaccinated. If you don't use Patient Gateway, the information that was provided through the registration on the town site has been given to us, and as it was with phase 1. And we have also provided that information to the Mass General so that phone calls can be made to individuals that are not in Patient Gateway so that we can do a manual scheduling process. We will also do the same thing at the Cottage Hospital with those lists. So there are 3 entry points, but the easiest and the fastest way to be able to get a vaccine is to register with the Mass General Brigham site. And I'll give that number now and again several times. That is register with Mass General Brigham, call 866-211-6588 to ensure that you're signed up and have an account. And sign up for Patient Gateway, and then you will be able to navigate this relatively easily on your own when you get notified that it's time for your age group or phase to move forward. For anyone with issues with the Gateway or those who are eligible and don't receive a phone call, obviously I've just said that the third thing is we will be manually scheduling those and taking those numbers that we've gotten off of the registration site from the town and moving forward with making phone calls. We don't know the allocations of vaccines from week to week, as Roberto had said. But we do know that in this first rollout, we'll call it a soft launch. We do know that we'll be able to get enough vaccine to take care of that 75 plus category over 2 weeks. Based on those who registered with the town of Nantucket for phase 2, we anticipate at least 650 individuals 75 and above will be vaccinated in this first phase of first tier of phase 2. Anyone in this age group who is not registered for phase 2 is encouraged to do so on the town's website, and scheduling will begin to happen as I described earlier. The subsequent tiers of phase 2, including individuals over 65, those with 2 or more comorbidities, educators, and others, as Roberta had described that the governor may add, will begin later in February. And we know that more than 4,500 people have registered for phase 2 through the town. So those will be the numbers that we'll be giving to the state, and we'll be working through getting those scheduling templates open as we know vaccine is available, and we'll move that along. So it's important to know that now is the time to start thinking about receiving the vaccine at the VFW. You must be registered in the Mass General Brigham system, Patient Gateway. That number again is 866-211-6588 if you're not. I would imagine that probably 90% of this island is already registered just due to getting COVID PCR tested or having gotten care here. But I would go online and check to make sure that that's still an active account for you. If you don't have one, then sign up. No harm in doing that. and that's Mass General Patient Gateway. Phase 3 of the state vaccine distribution plan, which includes the general public, is scheduled to begin in April. And we don't have the specifics about how much vaccine will be coming for that. We believe that we'll probably be using the same protocol now. It's a fast evolving situation. Today alone, there were probably 2 or 3 changes in how we would consider doing this process, and also how much vaccine would be coming forward. We recognize it's frustrating to not have a lot of information earlier to understand how this is going to move forward. But I have to compliment the town, Jericho, Roberto, Libby, others for setting up a website, getting early registration available, having seniors be able to get some assistance. And to that end, it's my understanding that the town is also making plans, although all the specifics aren't known yet, to help those individuals that can't access electronics or are homebound or other things. So stand by for our public affairs folks with the town and the Cottage Hospital, Jericho, and Roberto to put out some information related to how we will also make sure that all of those individuals get contacted. And of course, all this information will be coming out in multiple languages. We'll be connecting with all of our interfaith members, the churches, every group we can think of, in order to get the information out about how to get a vaccine and when. I think I've covered it all. I can't stress enough the importance of going to Patient Gateway and getting signed up if you're not. And just know that if you go there and you look to see if there are tests available once you've been, or vaccines available once you've been told you can sign up, if it's closed quickly because of demand, the next week we'll have another large amount, and it won't take long to get you in. So we're very confident that we're going to move through that 650 pretty quickly. We're very confident that we'll be able to start on the next tier that the governor's asked us to address, and that vaccine will be flowing for that as well. So with that, Dr. Pearl and I and Roberto and Jericho, Libby, we've been on a planning team for, it seems, forever to get to this point. There is hope here. This is the light at the end of the tunnel. And all we need to do now is continue to triple down, and let's not get COVID while we're waiting for the vaccine, as we're starting to see our numbers go down. It is so important to be very diligent right now and do everything you can to stay safe so that we can get you over this hurdle. I'm sure there's many questions, and so I'll open that up to all of you.
Bill Greeter had his hand up. It's down now, but Bill, I just wanted to give him a chance to raise it again, but maybe his question got answered. Okay. Board members? Jason?
Thank you, Madam Chair. Thanks for this report. You're right, Gary. It is a lot of hope. So I was on the website today. It looks really good in the town. It's very easy to find out where you need to go. So thank you for doing that. So one question, does it help? You said, Gary, we have 4,000 to 5,000 people registered. Does that help with the criteria of the state saying, look, we have 5,000 or 10,000 to get us more vaccines? So does that mean to really, I've already heard you say this, Roberto, but even if you're not sure which phase you're in, just register and get in there. Is that the message?
Yeah, Jason, that is the message. I think if you look at the world press and hear what's being said, there's unfortunate incidences where vaccine has been pushed out communities that can't actually get them in arms quick enough. And so, those areas are worried about wasting. What's really good about Massachusetts and the way we're planning on the island is that we have built an operational structure to get in the arms as many vaccines as we can get. And so that registration is important so that we can prove the fact to the state that we're in fact ready. We want that vaccine, and get it over here, and we'll start getting it in arms.
Are there any other questions, Melissa?
Thanks so much. I just want to have a couple clarifications, questions I've been receiving. Restaurant workers, forward-facing food industry, they are in phase 2. Is that correct? I see Jericho nodding. Okay,
yes.
Fabulous.
Restaurant, retail are currently in phase 2, step 3. Okay. And what about hospitality employees, people who work at hotels, transportation centers, things like that? Where do they fall?
I know that transit specifically has its own addition. We are waiting for more clarification on hospitality staff.
Okay, great. And so you'll let us know when we get that, because I know that I've been fielding a lot of questions from hospitality agencies about when their staff can get vaccinated. Thanks very much.
Jason?
I might be jumping ahead a little bit, but I've heard some misinformation. I think I brought this up a couple of weeks ago of, once you get your second vaccine, you're good to go. You can walk outside without a mask. Can we just clarify, how long it takes after the second dose for it to be effective, and how should you still handle yourself come April, May, June? Assuming you have both doses.
Roberto, do you want to do this one, or do you want me to do it?
Well, there's multiple facets in that question. I'll
Okay,
leave the immunological part to Dr. Pearl. But in a nutshell, it still takes a while for you to gain antibodies after you get that second dose. However, you should still be wearing masks. You should still be out practicing social distancing well past herd immunity, because when you're wearing the mask, even though you're also protecting yourself, you're protecting the people who haven't been vaccinated. So we should still be expecting mask wearing and distancing through the rest of the year. So we're expected to go back to relative normality in the fall, but like the main word to there is relative normality. It's a little bit more normal than it is now, but it's not quite normal. So you should still be you should still expect to wear masks and do proper distancing well for the rest of the year. As far as after the second dose, how long it takes to develop antibodies, I'm not quite sure. I'll defer to the hospital on that one.
Yeah, I would say by 2 weeks after your second dose, you're fully immunized and have your maximal antibodies. Of course, how long they will last, we don't know. This is also new. And I'm hoping to be a little more optimistic than Roberto about eventually the government telling us, either through the CDC or through the state people, when things can become a little more normal, but certainly not in the next foreseeable months.
I'd just like to add to that for those listening that there are studies now that have been initiated, some at the Mass General MGB system, that are looking at communicability after you've been vaccinated or infectivity. I'm hearing that early information looks promising. I don't know what that truly means, but I'm told that those results will start coming out in about the next 60 to 90 days. And let's just hope that it's like other vaccines that, you don't then produce an infection, or you don't have enough of that material produced to create an infection. Let's just pray that that's the direction that it goes, but it sounds encouraging.
However, good thing is the good news on the horizon on all of that is we can expect a better summer coming in as far as occupancy limits and things like that go. Masks and distancing protocols might still be in place, but I wouldn't expect 25% occupancy like we're seeing now.
If I could just raise the question one more time, just to make sure there's clarity on it. We just talked about a system to be notified and go ahead and register for a vaccine. But Jericho or Roberto, would you want to add some thought on how those that might need some help, or those that we're thinking about in the community that don't have an electronic device, how we might be able to reach out and help?
Jericho, I'll defer to you.
Thank you. Okay, so basically we are aware of there's probably going to be a gap between the people that can be easily serviced by the hospital and the people that cannot be, and that once we have a solid workflow established going through the hospital, the town is going to be running a parallel vaccination process at satellite sites. It's going to be designed for the homebound. It's going to be designed for the people who are not able to make it to the VFW site. We're sourcing the necessary equipment to set that up, and we're going to be working in conjunction with the hospital in terms of our storage and inventory management. We're also going to be working together with community leaders. We're going to be trying to recruit various members of the faith community of the island, and we're going to be trying to make sure that we have a safe, effective, and comfortable method for administering to everyone that the hospital cannot.
Christy?
Thank you. Just speaking about opening up for the summer, I was just wondering, with the latest Board of Health meeting, did we change any of our metrics in determining kind of how we're following this and what might change local regulations?
We didn't change any of the metrics. One of the things we're avoiding creating metrics that we're going to end up pigeonholing ourselves in that are going to end up being obsolete by next month, which is what happened with some of our previous metrics. If you've noticed, I've removed that little stop sign thing, the red green yellow slide in my presentations, mainly because the metrics, as we learn more, as more people become vaccinated, as treatments evolve, so should the metrics. So we can't, vote in a metric today that we'll have to vote out in a month. So what we're looking to do is maintain that same vigilance that we have been maintaining for this past year. And as needed, we would be voting in more emergency orders or voting out emergency orders like we did already too. What we've seen is I started charting our emergency orders in comparison to the state. So actually really quick, I'll do a quick share. And what we saw here is, I know it's hard for people at home to see, so let me zoom that in. So what we see here is that we had voted in a lot of our types of implementations before or right on par with that of the state. So I would say we keep this sort of a process up and running, where as needed, based on what we're seeing, we can do an evolving emergency order type response instead of creating a metric that we end up becoming slaves to that aren't always effective. I hope that answered the question.
Melissa?
Yeah, I just want to follow up as a Board of Health member. I think this is a really smart and responsive approach rather than a reactive approach. And I think we've learned so much about how to navigate this disease as a community, as a Board of Health, and certainly from a scientific perspective. So I think Roberto's leadership and correspondence with the hospital has demonstrated to be very clear and giving us good guidelines, and any concerns that we have, we just bring them up and talk about them. But I think metrics were something that gave us a sense of security early on in the virus, and there are more efficient ways for us to navigate these emergency orders going forward.
Thank you, Melissa. Gary Shaw, you had your hand up.
Yeah, just a couple of other pieces related to the vaccine site. So just to keep in mind that if we were to get more vaccines than currently projected, we do have the capability to flex in to that area at the VFW and give them. So know that we are ready, and we feel that we've got a good operational focus. I would ask that, because the VFW, it's not a small place, but it's really not big either. If you're coming to get a vaccine, if you would consider, if you don't need an escort or someone to help you, come by yourself, so that as we have you come in the building, we don't try to overwhelm seating or just the space. Remember, we still are in a COVID environment, and we want to make sure that we have social distancing, and there's a limited availability for seating in that area, except for those that are being vaccinated. So if you do come and you need a wheelchair, we do have that there. So we'll be making sure that those types of things can be accommodated. So less crowding would be good as you look to get your vaccine.
And a huge thank you to the VFW.
Oh my, yeah.
They are providing this to us at great loss to themselves, sacrifice. So we want to say really big thank you to the VFW for the work they have been doing to help us get the testing, the vaccinations up and running. It is at great sacrifice to themselves.
Well, again, and lastly, from us at the hospital, Dr. Pearl and I can't thank all of you enough for your leadership and support to get us to this point, to help us troubleshoot and find places in the community to be able to do the vaccines. We're on this island together. We're one community, and now let's put some energy back into the gas tank and let's start moving, getting these things forward and getting back to another sense of normality as we move through this summer. I couldn't be more excited and more proud of the team and all of you as well. So thank you very much.
Thank you. Shall we move to the COVID-19 Task Force weekly update?
All right, so for me, we have 3 basic points. I'll start with the numbers first and try and get through that as quickly as possible. Our total number of field inspections, which is basically any COVID-related interaction between an inspector and a member of the public, is up to 262. We have visited 209 job sites. We have made 64 enforcement actions, which is basically any time that we mask, educate, or do any outreach. We have a total of 10 citations right now. I don't have the number figure for that on hand, but I believe they're $300 tickets for the most part, so it should be about $3,000 in terms of the fines. We have received 16 tips leading to an enforcement action, 13 requests for clarification about job site procedures or what to do on your if you've been closely exposed. Roberto covered that, but again, just very quickly, there are those numbers he mentioned that you can reach out to CTC if you haven't received a call within 48 hours. There's also, you want to be visiting, if you're concerned about you maybe haven't gotten exposure, you should immediately go get yourself tested as quickly as you possibly can. And then you should be conscious of your exposure to other people subsequent to that. Let's see, we have had a total of 11 job site stoppages, primarily for logbook issues. And then we have made a total of 18 second passes to second sites where we saw potentially a need to do like another sweep through an area. That's about it for the enforcement numbers. Does anyone have any questions regarding those? It's not the most exciting stuff. Okay, the next item in my docket has been the smell test. We now have 2 competing smell test systems. One of us brought through to us by actually an MGB related organization that has already done a lot of primary trials on it. This one looks like it'd be a little quicker to get into an actual screening platform. We're currently discussing both. The Board of Health, Malcolm from the Board of Health is discussing things with the You Smell It, and then we are currently going to be reaching out and discussing the nature of the MGB-based olfactory test. Both are still screening tools. Both are still, a better thermometer for doing kind of base level screening, but both look to be fairly effective. Both look to be fairly useful, and whichever one that we end up deciding being more interesting, we'll see what their deployment plan is. Subsequent to that, the other enforcement information we have, there has been a relaxation in restaurant occupancy restrictions and in the the closing times for restaurants. So I think they're back down to 50% maximum occupancy for restaurants, and I think it's 12 or 12:30 for the final closure. Then today and earlier in this week, we reached out to all 4,500 members of the town sign-up group. The email sort of explained where we are in this whole procedure and what you need to do next. If you are concerned that you didn't hear the message or you weren't able to respond to it quickly enough, it was not a scheduling issue. It was just letting you know that we are about to move into phase 2, and there is no direct action necessary for that. We have, as part of those email communications, directed people towards the patient gateway in an effort to get as many people into that system as we possibly can, because that will smooth out the way that the initial vaccine rollout stages go. So yeah, you haven't missed your appointment if you did not follow that call. So do not worry about that. And then that is just about it for me. Any questions on that? Go ahead, Christy.
Christy?
Sorry.
Sorry.
Thank you. So with the scratch and sniff test, is that something that the town would endorse to roll out to the school or businesses, or what is kind of the plan with these tests?
We would need to see more information on the nature of the test and its best practices. There is, at least in the case of the MGB one, they've already done active trials in a variety of places, so they would actually be able to tell us the best way to deploy it. I could see it being a voluntary role in terms of retail screening. I could see it being in a number of different roles where a kind of a very quick, very nimble testing thing would work. It could also possibly squeeze into schools, but then you are going to start having to run into the necessity of a clinical verification of that in a school setting. This is not as strong an indicator of COVID, contracting COVID as a PCR test or an antigen test. And it is an effective tool when deployed in depth with a variety of other methods, but it's not a replacement for any of the tools we have now. What it basically does is just make things a little quicker and easier and give us a variety of different approaches to manage risk exposure, essentially.
Gary Shaw?
Yeah, I would just like to add, Christy, that those sniff tests are in research. They're not open and available for the general public, and we don't know that they will be. So it was enlightening to learn that there was an IRB research focus which had one particular sniff test in it. And we have a meeting set up with the primary researcher at the MGH to learn more about it. We do know that there has been a submission for a request for approval from the FDA. Those things take time, as we all know. So in the short run, they're not available, but they can give us some understanding of where that kind of technology might be going. I'm just not optimistic in the short run that we're going to see them.
Oh, absolutely. I would very much like to reiterate what Gary just said, which is that they are experimental. They are not yet fully approved for use. The MGB one is significantly further along in terms of its deployment, but it is still months and months away, most likely.
Thank you. Are there any other questions? Should we move on to the Economic Task Force update? Melissa?
Sure. Thanks so much, Dawn. So we had our second meeting today. 2 of our 3 subgroups met in between our main group meetings. The Open Streets, Open Spaces group was the only one that didn't get to meet. They're going to meet, I believe, on Monday. But our communications group met and came up with a list of some really great ideas, which I'll be in touch with town manager on about coordination efforts for that. I think there's nothing really new there, but our hope is to be able to streamline messaging to the constituencies that will be most impacted by any of these resources, opportunities, and close communication, of course, with Roberto's office and his team on just the kinds of restrictions as they're implemented or released. We want to help communicate that clearly to our business community. Our resources group is very busy working on a list of some great ideas and ways in which to support businesses, give them lists of resources, which we, of course, have been doing at the Chamber of Commerce, and I think the town has been sharing that information as well. But there are some other business-related resources we think will be helpful for folks, certainly economic resources that are in development. So nothing really new to share today, except that we're getting closer on some more definitive answers, and we hope by next week to be able to share with you some more concrete ideas on how these groups can work together to support businesses. So that's about it. I'm happy to hear from both Gary and Roberto the sense of optimism, but also sense of significant caution that we all as a community have to continue to employ. And it is, you know, although we may have some less restrictions in place, it's an important message for our business community to understand that this spring and certainly early summer will not be business as it was in 2019. Our best hope, I think, is that it will be like it was last summer in July, and maybe even a little bit more open. So, the other thing that we'll be setting up, and I will send this to the town manager as soon as it is an email address through our Chamber of Commerce site where people in the public and other business members can reach out with questions or ideas for this economic task force and be in touch with us. So as soon as I have that, we'll send it out and put it up on the website. I don't know if Janet is here, but Christy, did I miss anything?
No, I think you covered everything. It's been a very productive group, and we're making a good progress.
Yeah, we've got a really great team of business members on our task force, and I think everybody wants to volunteer their time because we want to give businesses the best shot at having the most successful season possible while keeping our community safe this summer. So thanks so much.
Thank you both for putting the time in for this. And I hope that local businesses have taken advantage of applying for the next round of PPP funding. Are there any other COVID-19 weekly comments or questions before we move on to the rest of the agenda? I'm not seeing any. Thanks again, everyone. We will move on to public comment for items not related to COVID-19 on our agenda or otherwise not on our agenda for discussion. I don't see any hands raised currently, but if someone wishes to raise a hand, please do so. I will move on to, there is no new business that I'm aware of. Approval of minutes and warrants. Can we take all three together as a motion?
So moved.
Motion to approve.
Is there a second? All those in favor by roll call. Christy Ferrantella.
Aye.
Matt Fay.
Aye.
Jason Bridges.
Aye.
Melissa Murphy.
Aye.
John Holgate, aye. Thank you. Next, we have presentations. We have NCTV 18 annual PEG Public Educational and Government Access Channel Report. Lisa Getter.
Hi, can you hear me?
Yes, good evening.
Hi, good evening, everybody. First, I want to say, I want to take this opportunity to thank everybody on the select board, the town, Board of Health and the hospital for all your hard work that you've done this year for us as a community. And I really, really appreciate that. And I've never felt more loving of this island than I do right now. I'm so glad that I live here because I feel so safe. So thank you very much for that. And in NCTV fashion, we're going to start this presentation with a video. We've done a lot of work this year, and we started off with a 7-minute video, and we've condensed it down to 3 minutes. And after the video, our Director of Marketing and Development, Arlene O'Reilly, is going to jump in and go through the presentation. Then after that, I'm going to be here for any questions that you have for us. So Frank's going to start the video.
NCTV has now become an integral part of what we have on Nantucket that keeps this community going. It's every bit as important as the Enquirer and Mirror.
We realized that without our office open, without our museum open for the season, we were going to lose contact. And so with the help of Channel 18, we feel like we've been able to connect not only to our membership and our current supporters, but it's allowed us to have a wider platform, a wider reach.
I can't even explain how great it came out. And I had so many people who reached out to me in the community who had never been able to experience what we do at the club so happy that we were able to see it live online and be a part of it. It blew away my expectations and just made me realize that there's a lot of things that we're going to try and do in the future with NCTV to keep as part of the process. So one of the things I mentioned earlier is we would only get 100 people in the room. Well, now we were reaching thousands of people.
We would come into the TV station, we would edit together, we would get all the support we needed to do that editing from the staff that was in the station at the time. When the pandemic hit, we weren't allowed in the station, and fortunately, NCTV allowed us to take a computer home with us, which was huge because it allowed us to continue working throughout everything. Not only are they open and kind and generous, but they also have a breadth of knowledge and they know what they're doing. And not only do they know what they're doing, but they're willing to share it with you. And they're open with educating you so that you can create what you want to create.
They enjoy their work, and you can see that. And so I think for those of us who are not used to being in front of a camera, it certainly makes everybody relaxed and feel welcome, and you feel like you're in their living room.
They came with a sense of humor, they came with a sense of creativity, and all the things that you really would want in support from a broadcast partner. And frankly, it made us rethink how we're going to do this in the future.
I don't think you could find a better group of people than the people at NCTV. And then, I mean, I don't know if you've ever been to their facilities, but they're pretty fantastic for 30 miles out to sea. So I think we're really lucky to have them here, and you'd be lucky to get to work with them.
So hi, everybody. This is Arlene O'Reilly. So I'm going to jump in here and share my screen with the presentation. Can everybody hear me okay? Thumbs up? Good, thank you. Okay. So NCTV is a nonprofit organization, and its focus is public education and government. We've definitely shown significant increase across the board on all levels. So our membership has increased for family, individuals, organizations, and businesses, including our donor support and business sponsors and foundation partners. It's an overall increase of 166%. Our original programming and partner programming and membership programming, as well as public service announcements, have grown substantially as well. We have gone above and beyond in creating PSAs, focusing on urgent and necessary communications, working closely with the town and the hospital. And this is a basic rundown list of what those PSAs were focused on, including, partnering with organizations like the Chamber of Commerce. We show a news ticker across our TV channel 18, which has also shown a significant increase of people watching the channel, as well as, basically, we created COVID updates working with Roberto Santa Maria, as well as talk shows focused on wellness and working with many of the health and wellness experts on the island. Our education sector, we have continued to serve the adult education, which is now all remote learning. It was at one time in the station itself. And we've also developed, youth education programs, which is an expansion of Whaler Media and focusing on Journalism 101, which is also partnered with ASAP in working with the youth of our island. And that is free to all youth students on Nantucket, starting from 8th grade through high school. thanks to our foundation partners and support. Our analytics, I don't know if you guys can see this. Sorry if you guys are not seeing it correctly. Our website has had a 500% plus increase of traffic. Our social media engagement has blossomed to 566,000 engagements. We have served over 40 plus nonprofits on the island and helping them bring awareness to their causes and help them increase their funding remotely. And our YouTube channel has more than doubled in views. The 3 most viewed PSAs were the people, real people wear masks, the town of Nantucket and Nantucket Cottage Hospital PSAs on COVID, and the COVID Minute update from Select Board Chair on April 10th. Moving along to town government, we have covered the list of meetings that are on the left, as you see. In addition to that, as NCTV has created several emergency PSAs that is paid for by its core funding with Comcast. And some of those PSAs are mostly COVID related, but there are also subjects on contamination and voting protocols during the pandemic. We have held steadfast through the year where we have worked 24-hour turnaround time, weekend services, and also expanded this programming to create subtitles in Portuguese, Bulgarian, and Spanish. We had increased our staff time in government coverage by 82% from 2017 through 2020. And also, as you are aware, there is an increase in the Comcast funding from 3 to 5%. This report is to cover the portion also of the Comcast funds that were used in 2020 for government broadcast. These numbers are outlined here by the town meeting coverage, public service programming, and the communications required to promote it to our general public and community. In addition to that, unlike any year before, we had accelerated greatly in the communications marketing aspect, and can see in our own analytics that we had driven traffic to the town website. So we feel that we are happy to report that we feel we've assisted with the growth of viewership, as well as increase the NCTV staff to accommodate the government coverage, spending over 1,138 hours of staff time on meeting coverages for the town of Nantucket, as well as developed communication strategies with the NCTV marketing team to keep the community informed and connected in real time versus on digital multimedia and TV. The final slide is the budget that was requested for the 2021 year, which is an outline which is included in your packets. And I will turn this over to Lisa for questions, and I'm happy to jump back to any slide that any of you might have questions on. Any questions?
I don't see any hands raised. It was a great presentation.
Thank you.
Does anybody have any comments? Okay. Oh, Brooke has her hand up. Oh, then I'll come to you, Melissa. Brooke? Brooke Moore?
Hi, sorry about that. I was waiting on the invitation to unmute. I just want to say it has been incredible what NCTV has done during this crisis. I mean, just amazing. And I particularly want to thank them for their willingness to stretch into the space of offering their their videos in multiple languages and making sure that our entire community has had access to critical information throughout this crisis. And I just wanted to say thank you to them.
Thank you. Melissa?
Yeah, thank you, Dawn. I just wanted to essentially echo what Brooke just said. I think that NCTV is an invaluable resource for our community. And if we didn't know it before, we certainly all learned to appreciate and value them this year. They've really been the thread that's kept our community connected. And for that, I'm very grateful. So thank you.
Jason, then Christy.
I'm just going to layer on those two good things that was just said because it's true. But I wanted to say that when you talk to other municipalities that are a little bigger than us, and they're connected to their channel and their community, they know about Nantucket, right? So just being connected to different people in those community channels, like Nantucket has held a higher standard. Like, oh wow, NCTV 18, yeah, they do great things there. You guys get a ton of awards, and so it's not just here. It's like, off island, people know that we have higher standards and the work that's being done. I was the board rep for my first 3 years, and so I got to see, and even before that, as public outreach manager, see the channel grow from the space and the programming, and so it's been really exciting to see that the public can see what you said, Melissa, that if you didn't know it before, you definitely see the value now. So it's like another coming out party.
Christy?
Thank you, Dawn. I mostly wanted to just echo what everybody else has said and to thank NCTV. This past week, there was the Mass Municipal Association virtual conference, and in talking to other municipalities, there's still some that have not adapted to Zoom meetings. They're still doing their meetings by phone, or they're choosing not to meet. So I just wanted to say kudos to NCTV for all they've done to help. I mean, I think we had one missed meeting since April, and that was just that first week. And since then, we've had all these great Zoom meetings, and we have great attendance and interaction with the community. And it's really attributes to the work that you guys did to help us get that.
Well, thank you all very much.
Oh, Bill Greeter has his hand up. Bill?
Hi, thank you, Dawn. I just wanted to echo what the board has said and actually add a little bit that the board may not know. NCTV has done a great job embracing the state laws as it pertains to the cable company having to provide some funding and the ability for the public to use the Cablecast network. And NCTV has done a great job of combining local origination plus the PEG process for the government channels, and come to be able to make it as a service that supports them individually, financially, and benefits the community. So great job. They've done a tremendous job of growth since when they first were a small entity, trying to figure out how to build a studio and embrace the ability that the cable laws provide, and just done a great job overall. And I wanted to throw my 2 cents in there. So thank you.
Thank you, Bill. Thank you all for being here tonight and for continuing to make this happen.
Thank you very much, everybody.
I'm going to move on to capital program committees, the FY 2022 capital project recommendations. Stephen Welch, are you ready?
Yes, Madam Chair. Can you hear me?
Yes.
Okay, great, thanks. So good evening, everyone. Stephen Welch, Chair of the Capital Program Committee. I'm here tonight to provide a summary of the Capital Program Committee Fiscal Year 22 report, the copy of which is in your packet and on the screen. And if we could pull up the introduction sheet and let that sit for a minute, that'd be great. Thank you. A couple of things before we start. First, kudos to NCTV. Wonderful attentive work they've been doing, and certainly a tough act to follow. So I think I would have preferred to be after the HCC appeal, but we'll take what we can get. I also like to, in observance of the open meeting law, I'll call this meeting of the Capital Program Committee to order. And I'll take a moment to thank the members of the Capital Program Committee for their service. Our members are Peter Kaiser, Vice Chair, Richard Hussey, Secretary, Jason Bridges, Select Board Rep, Christy Ferrantella, NP and EDC Rep, Christy Kickham, Member at Large, Peter McEachern, FinCom Rep, and myself, Member at Large. It's a devoted bunch. They invest many hours in review and recommendations. Given the cost and complexities that come before us, we typically begin meeting in late June, wrapping up weekly meetings the third week of January. It's a labor of love, and I'd like to let them know their contribution is appreciated. So many thanks to each of you. Also like to thank our town manager, Libby, our finance director, Brian, our relatively new assistant finance director, Rick Sears, and everyone else involved in providing information and support service to our committee. That includes the department heads and Ali Penta, the town's financial analyst. So thank you all. On the report itself, if we could scroll up one page to the table of contents, and thank you, and hold that a moment, that'll be great. So viewing the highlighted text, you can see we've presented information primarily 6 views. The first 4 views are the summary of capital allocations by account, summary of funding sources, FY22 request greater than or equal to 1 million, and projected cost of borrowing impacts. These views lend to a PowerPoint type presentation for a quick uptake. And for these, the appendices attached listed at the bottom of this page are provide granularity. The other views, Capcom's statement of procedures and our procedural recommendations, are in a narrative form within the body of the report in hopes of benefiting the community. If we could go down 2 pages, we'll start with summary of capital allocations by accounts. Thanks, that's great. So for fiscal year 22, Capcom received 55 requests totaling approximately $63 million. After examination, our recommendation is to seek an allocation for 52 of those requests, totaling some $56 million. As you can see, the recommendation amounts are presented by account and then by department. The general fund outlays total approximately 24 million. Enterprise account outlays are approximately 33 million. And each of the department's requests are detailed in Appendix A, which includes line item estimates of cost. I think it's fair to say at this point in the budget cycle, really with our preliminary recommendation provided to you in the FinCom in mid-December and a monthly presentation of the anticipated capital outlays, which began last October, that these cost estimates and the underlying requests are fairly well reviewed. The next page, please. Okay, so let's see. We're on summary of funding sources. These largely present the capital program articles as they will be at town meeting. And these are listed by general fund and enterprise account again. And if I'd done my work properly, the dollar amounts square up from page to page. The recommended general funding, the recommended general fund funding sources are the ambulance reserve, borrowing within the levy limit, capital exclusions, paying off those particular outlays within the fiscal year, and for larger line item expenditures, debt exclusions. These are for durations not in excess of the asset's useful life. Next is the facilities borrowing mechanism, and then free cash. The portion of free cash recommended covers several smaller cost capital acquisitions and maintenance and improvement requests. Our last funding source under the general fund is raise and appropriate. This represents our annual required capital investment, and that totals 1% of prior year's total local receipts, plus 1% of prior year's total collected real estate and personal property taxes. That's a long way of saying this year the total of the annual required capital investment is slightly less than $1 million. For enterprise accounts, which are next, the funding sources are borrowing, reserved, and retained earnings. Each of the foregoing general fund and enterprise amounts are broken down on a request by request basis within Appendix B. The next page, please. So this is a view into the outlays that are greater than or equal to $1 million, again, by general fund and enterprise account. And it seems we've developed a bit of a theme here. There are 15 requests greater or equal to $1 million. On the next page, here we address projected taxpayer impacts using the tax rates. The projected increase in the residential rate is approximately 6 cents. There you go, thank you. Is approximately 6 cents per thousand assessed value. The assumptions are listed below the table. The presumption for reporting a 6 cents per thousand increase is that each capital and debt exclusion, which by the way are non-permanent levy increases, pass annual town meeting and the ballot. And further down is a description and links to the enterprise account ratepayer rates and fees. The next page, this is probably the driest of the dry, but thankfully brief. It's being a description and links to the debt service, principal and interest tables. And on the following page, actually, statement of procedures. This page and actually the next 3 pages provide information on various procedures CapCon follows, which include working with the data-laden capital request form by use of a database, our prioritization and ranking process, and our annual timeline. The last of these 3 pages, if you go down 2 more, there we go, touches on our communication and planning efforts, which include keeping other town committees and boards in the know, our department liaison approach, and strategic planning sessions. It's a riveting narrative. And for now, I hope no one minds my having encapsulated those pages into a 15-second summary. Next up is our procedural recommendations. And these are included on the next 3 1/4 pages. In the spirit of the town's financial policies and procedures, these revolve around best practices. Their focus is to leverage the town's capital planning, budgeting, and asset management capacity. There's a lot of thought in these and good actions to be taken. Suffice to say for now, we as taxpayers like you appreciate the town's efforts, including to have brought Rick on to assist with the town's capital needs. Rick's really been great. Lastly, aware that, yes, the appendices, aware you still have a big agenda for you. I'll touch on the few remaining appendices by title. If you'll flip down, Appendix A was mentioned, Appendix B was mentioned. This just gives you a taste of the information you can find in the report. Appendix C covers our appropriations and expenditures to date for requests that are FY22 in addition to a prior year. The next appendix is D, which provides a view of the taxpayer tax rate history. And the final appendix is there's actually 2. Appendix E, which is the specimen of the data we aim to collect for each capital request and then process and review. And Appendix F is explanatory of the various municipal funding sources, in case anybody needs to brush up on those. If there are any questions or comments at this time, I'm happy to see what I can do.
Matt?
Yeah, no, thank you. Very, very complete, very good report. It's a huge improvement. You guys seem to do a little better every year, which is great. Landfill has money set aside. I mean, not the landfill, the airport has money set aside for PFAS under capital airport, including it. But what about the landfill? Is that covered? That's a question we've had from a resident as well. Was that in the capital for this year? Was that discussed?
Sure. I'll give you a quick response, and then if Libby or Brian want to follow up. We did not get any capital requests for solid waste for this fiscal year. There are some out-year projections, but nothing that we would be bringing forth in this particular report.
Matt? Oh, Matt, you just muted yourself. Matt, that's been.
There we go. Sorry. I was really intelligent then too. No, the other one you had a comment in there that I'm going to steal. You said something, it's worth doing. It's worth getting started. And Stephen, I thought that was genius. I don't know where you stole it. It's probably, famous, but I thought it's so true. Too often we don't get started on things because either we don't know how, or it's too complicated, or we want to do it perfectly. And I think the process you're doing here is proving that. I really like that.
Thanks, Matt. Anything worth doing is worth starting. Yeah, I picked that up somewhere along the way.
Yeah, it rang true.
Thank you.
Jason?
Yeah, I just want to throw in, I think this maybe the focus started last year, and it was there this year too, of really talking to, town admin, the departments and finance of each project, could it be done in the calendar year, or at least, really started in the calendar year, or sorry, the fiscal year that it was being asked for. And so that's, I don't know if we focused on that as much 3 years ago, Stephen, but I see it more now in our questions when we deliberate.
If through you, Madam Chair. Thanks, Jason. Yeah, definitely one of our priorities is our investing in requests that can be completed or at least started in a material way in the fiscal year. So there's that.
Are there any other questions or comments this evening? Matt?
Yeah, just a couple more comments. It's 6 cents. We say, oh, it's only 6 cents on the tax per thousand. That works out to be a bit over 1.5%. So it is meaningful. I think people are, too often you hear our tax rate is low. Well, and I have to say this and remind people every time, it's a math equation. Our rate is low, but our assessments are high. And what we're paying used to be, low in comparison. It becomes people's ability to pay that really matters. And so we do have to, it'd be great to get some of this back, some of the things back into the budget. It would be great to have it under the, and I think understanding where it is now will help us do that. But too often, and having this information helps, because too often we hear, oh, we need this and we need that and we can pay for it. We have to think about the people who are struggling and they can't pay for it. They're on a fixed income. It's not easy. And so just because our rate is low doesn't mean that everyone has the ability to pay that rate because their property is valuable. And so I think through this process, we have to recognize that and be very careful. When you look at where we're heading, that rate was low and was going down. If you look at those charts as the number was going down and it was a math equation, it's tweaking up now. And that's because of our spending. So.
Excuse me, Madam Chair, if I may, through you.
Yes, go ahead.
Thank you. So I think I don't necessarily disagree with Matt in any way. I think capital program committee members are focused on being frugal to utilize effectively economy of mobilization and keep costs down without being cheap and not without being short-sighted. And by cheap, I mean, sometimes when you don't spend $1 today, you end up spending 2 or 3 later on. It may also help to give a little bit of shape to that 6 cents per thousand assessed value, just some back of the napkin type calculations. The medium year-round annual increase is approximately $50.17. Those are approximate numbers, mind you. The average year-round annual increase is $59.39, and those would be for the duration of the general fund debt and capital exclusions if they are approved at annual town meeting and of course the ballot. And then that would start to come down as each is retired, noting that the capital exclusions are for a 1-year period and the debt exclusions are for the useful life of the asset. So I believe I've got that correct. But again, I just think it's important to give a little shape to those numbers as opposed to just 6 cents per thousand. Thank you.
Thank you. That was an important distinction. Are there any more questions or comments tonight? Rick Atherton? Rick?
Yeah, thank you. I just got my unmute sign.
Yep, go ahead.
Just a general comment for Steve and the board. And I note in the early paragraphs of the report, the word maintenance. And I get concerned a little bit that maintenance of our roads, our sidewalks, doesn't always have the same priority as new projects. And Steve, I hope the Capital Program Committee reviews that. I'm sure I'm not alone in being able to point out a number of, we'll call them repeating potholes or crumbling edges to our roads that I think need attention. And I hope that there's enough resources that those issues are addressed in a way that provides a more permanent response or improvement than we've had in the past. I'd like to take one other opportunity. Several years ago, there was an article to put reflectors on the Hummock Pond Road, the Nantucket Road, and the Pulpus Road as major roads that go out to areas where there's alcohol served and people come back into town in the evening, fog, bad weather. I think reflectors are a significant safety improvement. They were turned down by the process several years ago. And I just want to make the point to you'd reconsider those. I think it's an expenditure that's well worthwhile for the town to make. Thank you very much. Bye-bye.
Thank you, Rick. Are there any other comments or questions? If not, then I'll move on to the next agenda item. Real estate matters, which I will turn over to Ken Beaugrand to walk us through.
Thank you, Madam Chair. The first three matters in this section all relate to a short strip of land running in from South Shore Road. It's basically a dirt path that goes between the three properties involved. And it's a strip of land for those of you who may not know where the street might be. It's a strip of land that abuts Augie Ramos's property on South Shore Road on the left-hand side and the other two lots on the right-hand side. The first conveyance is with respect to an area of 4,400 square feet that would be conveyed to the Ramos Family Realty Trust. And the document requires that it be combined with the 24 South Shore Road property, and it cannot be used as a separate buildable lot or resold in any way as a separate parcel. And it can only be used for residential purposes or for the pre-existing non-conforming use of the property. The recommendation of the Real Estate Assessment Committee is that it be sold for $8,800 plus legal fees, which is $2 a square foot. And that is the recommendation of the Real Estate Committee. It is my recommendation as well that we move forward with this to be able to clear this up, provide clear title with respect to it, and get the matter sorted out for those three parcels. Are there any questions with respect to this? If not, I would entertain a motion as provided by Town Council.
Does someone want to reference the motion?
I'll make the
I'll move
motion.
I don't have a copy of the motion. I think you can just say motion to approve.
Yeah, I'll motion to approve.
Is there a second?
Second.
And are we doing items 1 through 3?
1 through 3. What I want to do, well, I'll just explain quickly the other two. So
Okay, so we'll just do number 1. Okay.
Yep.
All those in favor by roll call, Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
John Holgate, aye. That carries unanimously. We'll move on to item number 2.
Item number 2 is the exact same size of the lot, 4,400 square feet, exact same price. And this has the same conditions as the other. And the third one is a smaller parcel. It's only 800 square feet. And so it would have a price of 1,600 plus legal fees. So I would ask to have a motion to approve the transfer with respect, the conveyance with respect to the second matter, and then also a motion to approve with respect to the conveyance to the third matter.
Motion to approve number.
Oh, sorry. Go ahead.
Well, I'll move approval of 2 and 3.
Is there a second?
Second.
All those in favor by roll call, Christy Ferrantella,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
Matt Fee,
Aye.
John Holgate, aye. Those carry unanimously. Item
The
number
next
4.
matter, Madam Chair, is with respect to the temporary license as to use Ironwood Road in the Richmond development. As you are aware, the town sold the property that Richmond is developing to them. And some of the parcels with respect to the property are in land court. And this particular section has been tied up in land court for forever, it seems. And while we're making much progress and we're looking like we might be able to get something done reasonably soon, there's an urgent need to be able to provide a temporary license to Richmond because of the fact that the parcels that would use Ironwood Road have been sold, and they need to be accessed out to the main road. And so this is a temporary license that would just run for the period of time until the land court issues the deed so that we can, in fact, deliver the actual deed to Richmond. And the license provides that there's no liability whatsoever on the part of the town, and that Richmond will carry any liability with respect to anything, and if necessary, restore anything if any problems occur, but we don't anticipate that would be the case. Again, this has been reviewed by town council, who has drafted the license, and I would request that the select board make a motion to approve the execution of the license to the Richmond Group for the use of Ironwood Road.
Is there a motion?
Move approval.
Is there a second?
Second.
All those in favor by roll call. I can't see everyone, but Christy Ferrantella,
Aye.
Matt Fee,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
and Holgate, aye. That carries unanimously. Moving on to item number 5.
That would be Tucker's.
Tucker, I think the next 2 are yours.
Thank you very much, Madam Chair. We have 2 items that are really very much identical. These relate to the discharge of mortgages in association with a program originally administered by Housing Nantucket that was transferred to the town for rehabilitation loans originated from Community Development Block Grant money, which program began roughly 15 years ago. So simply by continuing to reside in each of their respective properties during the time period, at the end of the 15 years, the mortgages are satisfied and no repayment is due. And so in the case of both Roberts and Lockley, both have met the criteria of the mortgage, and we would simply ask for your approval to have these discharged.
Would everyone be comfortable making a motion on both?
Motion to approve.
I'll second.
Matt, thank you. All those in favor by roll call, Christy Ferrantella,
Aye.
Matt Fee,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
Don Holgate, aye. 5 and 6 carry unanimously.
Thank you.
Next, thank you. Next, we're going to move on to the public hearing portion of our agenda. I have a conflict with item number 1, so I'm going to turn the chairmanship over to Jason Bridges.
Thank you, Don. I'd like to open a public hearing to consider the taking of any portions of the paper streets, open space recreation for use purposes, general municipal purposes for the purposes of conveyance, a fee title, lesser interest. This is for a portion of School Street. Ken, are you walking us through that?
Yes, I am. This matter has been before you and has been continued for a while. And the reason it was continued was there was a problem with respect to how to be able to implement this, because there are electrical and utilities that run through here. But what we had to do was to be able to figure out how to be able to allow for the taking, but not disturb the electrical and utilities that run through here, to allow to be able to do that. The parties have finally worked out an agreement with respect to it, and counsel for both sides have agreed to it. And so therefore, we've reviewed the matter with town council, and it is our recommendation that the select board move forward with respect to this order of taking. And then at some point at a subsequent meeting, we will be coming back to you with a disposition with respect to the property that's the subject to this, to finally get this title matter cleared up in this area by Gladlands Road.
Okay, this is a public hearing. I'll wait for a couple minutes to see if there's any attendees with any hands up. Any board questions? Comments for Ken? Nothing. Okay, let's give a couple more seconds, see if any hands come up here before we close the public hearing. All right, I'm not seeing any. Okay, we'll close the public hearing. What's the pleasure of the board?
Motion to approve.
Is there a second?
Second.
Okay, all those in favor by roll call: Melissa Murphy,
Aye.
Matt Fee,
Aye.
Christy Ferrantella,
Aye.
Jason Bridges, aye. I believe Dawn is recused, so that passes 4-0.
I think you need to close the public hearing.
He did.
He did.
Okay.
I can open the public hearing on item number 2. Turn it over to you, Ken.
Okay, this is again a proposed order of taking by eminent domain for 2 paper roads. If you look at the map, when you come down Lover's Lane where it turns into Orkawa, and then if you go a little further, there's White Street. You see that the sort of property on the left-hand side there has those 2 shaded paper roads in this property, right in this property. So the proposal is with respect to the order of taking for those, and then subsequently we would come back with a conveyance of those paper roads to the owner of the property with a recommendation as to a price and moving forward with it. So I'd be happy to answer any questions. But the document's been drafted by town council, and we recommend moving forward with respect to this.
This is a public hearing, so if anyone from the public wishes to speak, please raise your hand. Are there any board questions or comments? Okay, I'm not seeing any hands. I just want to give it a second. I'll close the public hearing, and can we move to a vote?
Motion to approve.
Is there a second? All those in favor by roll call: Christy Ferrantella, Matt Fee,
Aye.
Melissa Murphy,
Aye.
Jason Bridges,
Aye.
Don Holgate, aye. Thank you so much. Thank you, Ken. It is so great having you on board handling all of this stuff.
Well, I try to make it understandable. So thank you.
It's appreciated. Town manager's report. I'll turn it over to you, Libby, for budgets.
Thank you, Madam Chair. So we have this one budget that was carried over from last week's meeting, the Sewer Enterprise Fund budget for fiscal 22. And our Sewer Director, David Gray, is going to present with support from the Finance Director if needed.
And good evening, everyone. Thank you for having me. I got worried that my computer went off. There we go. What you have in your packet is the detailed and itemized budget for the Sewer Enterprise Fund. I don't know, I missed last week, so I don't know how you went through it. Did you want me to go line by line? Do you want me just to take questions and go that way? I just don't know how it was done last week, so.
David, I think that you are going through the highlights and then the board members will ask questions if they have any.
Okay. As you can see, our projected budget and our expense numbers are all listed on the green side. This was all before a lot of our new regulations went into effect in our budgeting and our fee structures. So I think ultimately I'm hoping that at the end of this fiscal year, we don't show that negative deficit as is shown there now. We're hoping that that will definitely be reduced substantially or hopefully eliminated altogether, but I can only wish on that. The next page, Erica. As we can go down through the lines, if there's anything that's jumping out at anyone specifically that I could touch on, I will. We are fully staffed. We have not taken and added any more personnel, so we were seeking another administrator in the future, but it does not come as part of this budget. Some of the numbers that you can see there, we have had to increase retirement, definitely went up some. We were able to take a lot of costs out of some of our lines down below from electricity down and reduce them by set numbers to take and try to balance out everything else. One of the bigger ones you see there was our rentals and our leases. We had been seeking 25,000 last year. We didn't use nearly as much as we anticipated. So we were able to drop that line item by 15,000 and therefore be able to spread it out across other line items that had some increases on them. Trying to pick some of the bigger ones that I can just try to explain some. Buildings and expendable supplies and equipment is that's just an ongoing maintenance thing, and we have most of our structures here were built in 2008 or they were converted over from original buildings in 2008 and then renovated. And we're starting to have issues being this close to the coast. Corrosion is really playing havoc with our equipment out here, and we've recently lost 2 garage doors because of corrosion. We luckily have a facilities and buildings grounds crew here so that they were able to temporarily build a filler spot for one of our garage doors where our sludge truck goes, and we can still get our dumpsters in and out. And we have another door that we cannot open right now because if we do, it's going to disintegrate. So we have ordered a garage door ourselves, and we're going to install it ourselves. So that's some of the cost increase you see in that line. It's just ongoing maintenance, and we actually have some items out here that are actually stainless steel that we experience severe corrosion with. So it's the shoreline's not playing our friend very much at all. think a lot of the other lines are fairly self-explanatory. We were able to decrease some of our OSHA training, mainly because of COVID restrictions. A lot of our stuff has gone remote learning. Eventually, we're going to have to get back into doing the hands-on certification training, but for the time being, they're allowing us to do a lot of remote learning, so we were able to put a decrease there. Some of the other stuff, we had substantial decrease in our professional services. Luckily, with in-house engineer now has been assisting us on a lot of our stuff. We're still using outside consultants on a lot of the much larger stuff, like with our CMON programs and a lot of our sewer projects. We're still using a lot of outside consulting firms, but we were able to bring that down quite a bit this year, because a lot of the projects that we have going on, the bigger projects, have already been contracted out, and we're actually in multiple different stages and phases of projects now. There is you will notice a pretty substantial increase in lab testing that we have sought, and a lot of that is based on because of the BioBot training, BioBot testing that we've been doing weekly, and some potential and probable PFAS testing that we're going to have to do in the future. So that's a fairly substantial jump in our lab testing. I know you guys get the results from our wastewater testing weekly, and it's been remarkable. And working with Roberto and everybody with that data that we get, it's amazing how close the numbers in the sewage have been compared to the testing at the hospital and what we're actually seeing. It's been fascinating to learn how that works. So that's probably one of our bigger increases in the line items that you'll see. I don't know if there's anything else specific you want me to actually address, but I'm open for questions if there are any.
Does anybody have questions for David? Thank you so much, David. I like your background.
Thank you. And just so everyone still knows, we are continuing our lining projects of a lot of the manholes. A lot of the mainline stuff has been done. There's still going to be some opportunities if anyone wants to see that. I know Jason and Matt were able to see it, and it's pretty amazing and fascinating how well that's been working. So I want to thank everyone for your support, and thank you for having me tonight.
Thank you. We appreciate it. I think that wraps up town manager's report tonight. We have committee reports on next. Does anyone have any committee report comments tonight? Okay, then we'll move on to our last public hearing, which is to consider the appeal of Axmart Energy of the Historic District Commission disapproval of a certificate of appropriateness for rooftop solar panels located at 9 Dennis Drive.
Good evening.
You know what? I am having some in terms of pulling up the packet and my screen at the same time. So can someone walk me through the order? Or yes, share them on the screen. Thank you. I've opened the public hearing. The appellant will state his or her case and the reason for the appeal.
Hi, this is Tim Carruthers. So you'd like me to make an opening statement?
Yes, please. Please go ahead, Tim. Thank you.
Sure. So my name is Tim Carruthers. I am the Director of Operations for Axmart Energy. We are a Nantucket solar installation company. We help Nantucket residences and businesses achieve their goal of reducing their reliance on fossil fuels and becoming energy independent. We are heavily vested in the long-term sustainability of Nantucket. We agree that the HDC has the right to jurisdict solar panels. However, we believe solar panels are a modern day housing feature and necessity, similar to air conditioning and satellite dishes, for example. Whilst the HDC may not like solar panels, their determination of appropriateness must take into consideration a neighborhood's lack of historic significance. Solar panels are a residential appliance and should not be limited to industrial neighborhoods or only allowed when they cannot be seen. The HDC's current position on solar panels limits an installation to either no or limited visibility. This effectively eliminates any Nantucket property that is located on the north side of a street from having solar panels, such as 9 Dennis Drive. In this era of climate change, this is overly restrictive and discriminates against many Nantucketers from achieving a clean energy future. In our appeal for 9 Dennis Drive, we will show a list of reasons, mitigating factors, and existing precedent, and some Mass state laws that we believe supports a determination of appropriateness for 9 Dennis Drive to construct a solar roof array.
Oh, thank you. Now do I go to the HDC?
Well, are we going to see the presentation first?
So we did have a presentation.
Tim, sorry, Tim, didn't you suggest that you were going to do a presentation about why it's appropriate?
Right.
So
we can't see
Tim, before you do that, hold on. I'm going to let Dawn explain it.
We can only see what was in our packet as a presentation this evening. If it's something something that you wish to provide, we could continue this hearing. But we do have to limit it to what is physically in the record at this time. We've had that advice from our counsel.
And that's fine, because the content in the presentation is essentially identical to the actual appeal that we sent in.
There might have been a couple of additional photographs that maybe you could eliminate.
Right. So we have some bullets that we would like to go through, which is in the packet, if we could, on a bullet. But okay, great. And
do that at this time.
Absolutely. And the owner was intending to speak. I'm not sure if he's on. Can we let him in and let him speak if he's on the call?
Yes.
I just brought Mr. Morrison.
Okay, great.
Okay. Wes, can you hear us?
He's muted.
Okay. All right. Am I still muted?
No, you're not muted now. Did you want to speak before?
Right. Yes. Thank you, Madam Chair. My name's Wesley Morris, and I'm the husband of Martha Morris, who's owned 9 Dennis Drive for the last 32 years. Lived here off and on, never rented it, but lived here off and on for 32 years. And although Martha's certainly capable of making this presentation herself or making the owner's statement, she's an epidemiologist, actually a doctor of epidemiology, works for the Massachusetts Department of Public Health. So she's been pretty busy with this pandemic stuff. So yeah, she asked me to step in because I've been practicing law here in the courts of the Commonwealth for the last 43 years. This is the first time she's ever asked me to step in, so I better do a good job. Just want to say a couple of things. Tim has the matters well in hand as to the neighborhood. It's a lovely neighborhood, wonderful people, but it's the farthest thing from being historic in any regard. I mean, we have it's about as far from the old historic district downtown and the old Sconset historic district as you can get. It's a mid-island property, and it allowing the solar panels would not impact anything historic, and that's what the Historic District Commission is designed to do. That is, protect the history of the island, and we support that. At any rate, I told Tim that I would talk about the decision of the HDC itself and the grounds that and I'm sure from your experience and from your instructions from town council, there are very few grounds upon which you can overturn the decision of the HDC. Only if it's unreasonable, whimsical, capricious, or arbitrary, basically. And that's pretty narrow. But and certainly we would, as far as whimsical or capricious are concerned, no way we'd ever allege the HDC was somehow whimsical or capricious. And anyway, these are serious people. They take their duty seriously, and whether they believe it or not, Martha and I do appreciate the devotion and efforts, spending countless hours to protect Nantucket's great historic legacy. However, they did make a mistake this time in denying the solar roof installation, and the denial was unreasonable under the circumstances. That's one of the items in there, and you'll notice that we need not prove all of the things, unreasonable and whimsical and capricious and arbitrary. It's either or. The or is the disjunctives all through it. So we need only prove one of them. I'm going to talk about the unreasonableness very briefly because it's getting late. And Tim and Tobias Glidden are going to discuss the rest. That is the arbitrariness. Now, oftentimes people can have differences of opinion and as to what is reasonable, reasonable interpretations. But we're dealing with a property here with no historic value, with no historic history in the neighborhood. And there is a statutory mandate, which is in the packet that was submitted to the board. It's, I'm referring to Section 7 of Chapter 40C, which, whether it's applicable to the Nantucket HDC or not, indicates the intent of the Commonwealth of Massachusetts, of the government of the Commonwealth, with regard to solar panels. And if I may, I'll quote it. While ruling on applications for certificates of appropriateness for solar energy systems, the commission, that would be the HDC, shall also consider the policy of the Commonwealth to encourage the use of solar energy systems and to protect solar access. Taking that mandate into account, whether or not it's applicable here, but it indicates a statewide policy in favor of solar installations. There is essentially no downside. Also, as a final note, when taking into account reasonableness, 9 Dennis Drive is at the end. Dennis Drive is a cul-de-sac. 9 Dennis Drive is down at the end. Virtually no one goes down to the end here unless they're delivering packages. The mail people come, UPS people come, FedEx, all that. But other than a couple of our neighbors, no one else comes down here. And thus it's not going to have any impact, no negative impact on the history or the historicity of the island. And there's a mandate, a statutory mandate that the commission should take into account the policy of the Commonwealth of Massachusetts to encourage solar installations. Thus, it's unreasonable. The decision's unreasonable. And I would urge the board, the select board, to remand this, you can't order them. As you know, this is another thing I'm sure town council told you. You can't order the HDC to issue a certificate of appropriateness, but we would ask that it be remanded, excuse me, remanded to them to take another look at it in the light of what we've just said. Now I'll turn it over to Tim.
Thank you, Wes. So can I continue?
Yes, Tim, go ahead.
Thank you. Great. So just going through the specific grounds for appeal, the property 9 Dennis Drive, in terms of the options that we have for installing solar, it is located on the north of the street, and the only elevation that is available for solar on that property is the southern facing elevation. If we were to put it on the north, then it wouldn't be financially viable because the sun doesn't shine on the north side of the house. The lot is too small to support a ground array, so that is not an option either. I won't go into the historic aspects because Wes has already covered that. I will note that the abutting neighbors of 9 Dennis Drive, Wes's neighbors, all signed a letter supporting the installation of a solar array at 9 Dennis Drive. We also proposed with this installation, the installation of solar skins on top of the solar panels. And solar skins have the effect of making the solar panels look like a shingle. So that would further blend the solar panels into the background with the roof. The solar array was designed, we've sized it to completely cover the roof so that it is just one continuous plane. If we look at the HDC's solar guidelines, there are several guidelines, specific guidelines, which we actually believe we meet. So if you look at the solar guidelines, which are published on the HDC's website, they have 3 guidelines, which I quote, the appropriateness of a photovoltaic solar thermal system will be based upon the historic character and architectural significance of the individual structure to its relations, to its relation to its surroundings. And we've already stated 9 Dennis Drive is not historic. It goes on to say in the guidelines that the panels need to be designed carefully and positioned to be in scale with the structure's roof line. Well, I've stated we've done that very carefully. The proposed solar array covers the entire southern elevation, and it adds no additional angles or roof lines to the property. And lastly, the system should be on the same plane as the roof, with the color of the panels in keeping with the surrounding roofline materials. So that has also been achieved. We're exactly on the plane of the roof, and the solar skins emulate the color of the roof. And the last point that I'll make is that and there are 3 examples in the packet that we provided. There are now many, many, many examples around the island where solar panels, the full solar array, can be seen from a public way. So, and as you can see here, and I'd actually commend these. They all look good. We're in support of them, and we're not saying they're a bad thing. We're actually saying they're a good thing, and we believe they set precedent. And the system that we're proposing to install at 9 Dennis Drive would look very similar. So thank you for allowing us to present our case.
And then lastly, Don.
Go ahead, Toby.
Go ahead.
If I could just wrap up very briefly. I think what we're ultimately looking for is, we understand the HDC does a great job. We've tried to meet their guidelines. We like the black panels filling out the whole roof. We've gone a step further by taking another mitigating step to put on skins. But ultimately what's happening here is that the HDC is, substituting, their opinion for what, is historic outside of their jurisdiction. So, the HDC is being inconsistent in applying their standard across the island. For example, in the historic district, there's a number of buildings with asphalt shingles, which are not historic. The HDC has done an excellent job in evolving its standard to allow asphalt shingles in the historic district. They've done an excellent job in applying their standard with heat pumps, satellite dishes, AC units. And in this context, this building is not historic. And we believe that the HDC, in an effort to try to make good designs, is kind of going too far in setting their standard. So we look forward to working with the board, working with the community to kind of line up a standard that's appropriate moving forward.
Thank you. Shall I move to the HDC's presentation now?
Sure.
Okay.
Yes.
Thank you, Madam Chair. How are you?
Or Kathy, hi.
Hi. So this application was denied in November, but it's important to know that it was reviewed over the course of 3 meetings, July 6th, August 3rd, and August 10th. The first time it went before the board, they had solar panels and they discussed the problem with mitigating the visual impact due to the fact that the panels were on the second floor roof facing the street and that there was a lot of vegetation, excuse me, in front of the house. So the board asked for revisions and Tim came back with solar skins. Solar skins is a new technology, and it's not that the board doesn't like solar skins or solar panels, but they requested a mock-up be placed on the roof and then placed for review. So the board came back on August 10th, and that was not done. The applicant preferred it as a pilot program, but the board really wanted to see the panels on the roof as it looks during the day, and that was not provided. So they didn't feel comfortable. So they withdrew the application. Fast forward to November, they proposed the same again. They did provide an example of solar skins on Margaret's Way, but those can't be seen from the street. So they didn't want to provide revisions. They didn't want to withdraw. So they asked for a denial. And here we are. But as far as Nantucket is the whole island's deemed historic. Therefore, its entire island is up for review. The board does make decisions on a case-by-case basis. Those examples that Tim showed, 3 Marianne Drive and 19 Old South Road are in a commercially zoned district. 11 Pond happened to be approved with conditions. The conditions were to plant 2 deciduous trees in that view on page, I think it's 184 of the packet that Erica had up, but the trees died. So I did reach out to the homeowner and they've rectified the situation. So there is vegetation at 11 Pond, but that view right there, the trees that they had planted had died. So, they try to make concessions on a case-by-case basis. This house was outside of the old historic district, but at the end of the day, they just didn't feel that with the technology and not knowing enough about it, they didn't feel comfortable approving it.
Thank you.
Can I speak, Dawn?
Yes, Ryan.
Thanks. For the record, Ray Pohl. So Dawn covered a lot of what I think our concerns were. I think that, one of the points that was being made earlier was that this is outside of the historic district, but we all know that the entire island is a historic district, and it may not be downtown Sconset or downtown Nantucket, but it is a historic district and has been so since the 60s. So to say that the area has no historic value, I don't believe is true. So clearly everything that's built on Nantucket and any revision to any building it comes to this board. And the reason why is because the entire island is a historic district. So we take everything under consideration. So, this is a little bit like if, we travel to some other area where they allow aluminum siding and flat roofs and, plastic fences and things like that, sort of the stuff that I see when I go down to Florida. It's like saying, well, because we're not in the old historic district of Sconset or downtown Nantucket, well, then it's all right to do this stuff because it's not historic. But the whole point of having the island as a historic district is to keep things consistent. And I should have led this entire thing off by saying that our board, the members of the Historic District Commission are every bit as much in favor of alternative energy as anyone else, although we have all been tasked and voted in to enforce the idea that everything that's done on Nantucket, regardless of where it happens to be, is being done in a historic district, and we have to pay attention to that. So the solar panels in general, it's regrettable that we can't just approve them on a roof that's facing directly to a public way, but we're just not comfortable with that. And frankly, the photograph that was shown earlier of 19 Old South Road, I consider to be a terrible mistake. I mean, our board does make mistakes every now and again, and I feel like that's one of them. And so we're trying our best. And by the way, one of the people on this session is Val Oliver, who you all know is a member of the HDC, and spent time with Stephen Welch going through and creating some guidelines that we all adhere to when it comes to reviewing solar applications. So it's a very, very difficult task for a lot of different reasons. But those are the guidelines that we try to adhere to. And so this, I'm not sure that I want to get into the mock skin part of this discussion right now, because I think the discussion is really beyond that. It's really about sort of the appropriateness of solar and, where it can go and so forth. And that's one thing that Val and Stephen worked very hard to determine. So I think that we were, there was another thing here, and that was whether we were unreasonable. Well, what comes before the select board is whether we're arbitrary and or capricious, not unreasonable. Unreasonable is in the eyes of the beholder. So we were acting in a way that was consistent with the policies that we had established. So that's what I have to say for now. I'm certainly around for questions. Val, did you have anything that you wanted to say, or I should turn it back to you, Dawn? I'm sorry. Go ahead.
That's fine, right? Whoever else from the HDC wishes to speak. Val, did you want to say
something? I want to be clear, and I'm sorry, Ray, if it was confusing. We didn't make the solar guidelines. We're trying to take something that was put together.
Right.
I'm not exactly sure what year. I think it was around 2009. It was a group of people, Sustainable Nantucket. There were some HDC members.
Right.
Clean Air, Planet something, whatever. And they established these guidelines as an addendum to Building with Nantucket in mind. Stephen and I have been trying to update that guidebook, but it's an arduous task. So I agree with what's been said already. I thought we're reasonable asking to look, sure, we'll look at the skins if you think those are going to work. And we didn't get an example. So it was hard for us to say, yeah, sure, go ahead. And, it could be a catastrophe. So who knows? But I don't think we're unreasonable. There are installations that come in constantly that put panels on something other than the south side. So I think I had suggested maybe the west. There's a bump to the west there, and that was negated. So yeah, I think we just need to either form some sort of a group and come up with some ideas about how to handle these things, but we cannot let these proliferate all over the island on the front of structures. Whether you consider mid-island, worth saving from anything is an individual situation, but we're doing our best to keep the island to have some integrity, and that's all I have to say. I don't think it was arbitrary, and I don't think it was capricious, and I don't think it was personal. Our decision. We were asked to deny it, actually, so they could appeal. And I guess I would just say to the select board, this is a place where we have to sort of come together and try and work with each other, because I have a feeling that it's going to happen more and more. And we should all be on the same page. Thank you.
Thank you, Val. George, how should I proceed now?
Usually you ask before you bring it to the board if there was any public comment. I don't know. Did you want to hear any more comment from anybody?
Do we go back?
Rebuttals is next.
Okay. At any time, if someone from the public wishes to speak, please raise your hand so I know that you're wanting to comment. Shall I go back to you, Tim? Are there any rebuttals?
I do have a couple of things to rebuttal. So I just want to clarify the order of how things played out. So we presented the original project. We were asked to make revisions. We came back, the revisions that we came back with and were to propose solar skins. The board, the HDC said they would like the solar skins to succeed, but they were uncomfortable approving them on that property because it was southerly facing. And they asked that we find another property that we could prototype the solar skins on. We did. We went off and we found another property. That homeowner wanted to do solar skins. We installed the solar skins on that project. And then the third time we came back in front of the HDC, we showed that project as an example for the solar skins. So I just wanted to clarify how that played out. And second, and lastly, on the third time we went up, I didn't ask for a deny. I just asked for a vote. That's all I asked for.
Thank you.
Thank you.
Anything back on the HDC side?
Sure. I think if you looked at your packet and saw the example of the skins that were used on the house that can't be seen from anywhere, you would see why we have reservation. That's all I'm going to say.
Thank you. We do have a public comment. Rick Atherton has his hand up. Oh, Tobias, I'll go to you first and then I'll go to you, Rick.
So lastly, and I wanted to thank the HDC for being on this evening and the select board, but I think the important piece here is, the HDC has made it clear that solar is okay in certain contexts on the front of buildings with some amount of screening, filling out the whole roof. We met that standard and we went beyond it by adding in solar skins. The HDC wants to be reasonable as far as solar goes on the island. We took an example before you, created something, it's on a gray roof where the HDC likes to see solar traditionally on a black roof. So if this was an all black roof, the system would look even nicer than it does. And so what we're just simply asking for you is to hold, the HDC to a reasonable standard. They allow AC units, they allow solar in other parts of the island, in residential areas, and we would just ask for that, reasonable standard to be upheld.
Ray, one last rebuttal, and then I want to go to the public comment.
I just want to rebut one thing there. AC units. Dawn, you were on the HDC for many years. When we have AC units come in, what is the first thing that we ask for? Screening, complete screening so that they're not visible from a public way. We don't just allow them to go like in the front yard so that everybody can see them or on the roof where everyone can see them. They go behind screening, either vegetated screening or fencing or both. That's a standard that we use all the time. So that's my response to that. Thank you.
Thank you. Rick? Rick?
Dawn, I'm unmuted now. Thank you.
Yep, there you go.
Just a general observation. I think we're going to get more of these. I think the community would be well served by the board supporting the HDC at this point and developing a process to find a reasonable accommodation, if there is one. You know, it may well be that our solar efforts as a community are better focused on the kind of project on Milestone Road, or what might go at the sewer beds or at the landfill, and not on individual properties that have architectural and viewing problems before them. So I think the board could be helpful by developing a process to have that kind of a conversation. Thank you.
Thank you. Are there any other public comments this evening? Did the board have questions of the applicants or the HDC? Jason?
I just have some clarifying questions. Just help me understand a little better. So the examples of 3 Marianne and the other one at 19 Old South, those were kind of like, those examples don't work because they're commercial. So are there different rules for commercial? So those can be viewed from the public way and those are okay?
No.
Is that right? Or
So
Val?
I didn't understand, like, well, those are commercial. So those are kind of like put to the side. You can't use those as an example. I didn't understand that.
I can respond.
Tim, you want to respond?
Oh, I think that was for the HDC now.
Yeah, I think it's more for HDC on, I'm just trying to think of the reasoning and what you use to make the decision.
Okay.
Right.
Kathy, do you want me to answer that?
Sure.
Okay. So a certain amount of, there's truth to some of that. For example, for those of you that are familiar with Tomahawk Lane, out by the airport where the old excavation was, and they filled that area in. And now that's basically all commercial buildings. A lot of them have metal siding and metal roofs that are probably 4 and 12 pitch or less. You know, that's a commercial area, and we've been pretty liberal about allowing solar there because it's, you know, it's in a neighborhood where there's nothing but other commercial buildings. It's right by the airport runway. You know, it's basically down in an old quarry. There are so many reasons why we sort of say, okay, well, that's all right. Oh, and the flat roofs on these large commercial buildings, by the way, make it more difficult to actually see the panels up there because they don't have the roof pitch that we require on residential buildings. So that's an exception. But when you get to someplace like Marianne Lane, where you have the, you know, the RC zoning where there's residential and we require steeper roof pitches and shingle siding and that sort of thing, then we definitely apply the same standard that we would if it was just a residential neighborhood. So I hope that's helpful.
That answer your question?
Yeah.
Go ahead.
I had one more kind of clarifying question. So is the standard, if it can be viewed from a public way, it's not being approved? You know, unless it has some kind of screening.
Okay, so I think Kathy and Val both mentioned this. What we're looking for is devices that will mitigate the visual impact from a public way. Now, what does that mean? That means that if you have black panels that are on a black asphalt roof, that mitigates it because there's no contrast between the roof shingles and the panels themselves. If the roof plane is facing to the side rather than straight to the front of the public way, that's a mitigating circumstance. If there's vegetation between the public way and the panels, that's mitigation. So these are the sort of things that we look for as possible concessions and ways that we can get to approve the solar panels. Again, you know, we're not fundamentally opposed to solar technology, quite the opposite. We're predisposed to want to approve this stuff. So what we're trying to do is do it in such a way that is still harmonious with the context of Nantucket Island. That's what we're doing.
Christy?
Thank you. I just have a follow-up question on that. If trying to mitigate is having the same color. Why were the skins, from the pictures, it looked like it was a very similar structure to the roof. So why were the skins not approved?
Well, so the skins are interesting, and I would go right back to the promotional literature, if that's possible. There was Erica, are you in charge of the screen right now?
I am. Hold on one second.
So it's funny, the promotional literature. Sorry, I think that looking at these pictures will describe fairly well what our concern is.
Is this what you wanted to see?
Well, all I see is something that says Erica Mooney right now.
Oh, sorry. Here we go.
There you go, screen sharing. Okay, now go down to the bottom and there's pictures of like 3 or 4 houses. I saw them a little earlier there. There we go. That's it. Up, back up. There. Okay, stop right there. Okay. So the picture on the right-hand side, okay? What you're looking at is like basically a plastic film that's applied to glass of the solar panels that's flat on top of what are probably 3-tab asphalt shingles. Now I'm going to ask a question of all the board members. Do you see them? Do you see them there lying on top of the roof with the big black frames around them? The answer is probably yes. They don't blend in. They're very conspicuously not roof shingles. So this is kind of like those skins that they put on buses in New York City that have advertisements on. You know, it's like David Copperfield or Elton John can be on there, and you know it's not them. You know that it's just a picture. So that's our objection to these. Although, back to what Kathy said earlier, we did request these to go on or to get a sample of something. I don't believe we were ever given that. So, we're interested in looking at it, but we're skeptical because it does have that black frame around it, and that's part of what we're objecting to. Hope that was helpful. Thank you.
Ray, I don't want to belabor this too much because I know our decision is really whether you're arbitrary and capricious.
Okay.
But I do think that this is kind of an important conversation to be had as we're moving so far into clean energy initiatives, and it's a goal of the board. If this were a situation where the roof was black, or where the homeowner chose to change their roof to 3-tab black shingles, would it have been a more approvable?
Oh, absolutely. Absolutely. Because
so there were some alternatives.
Yeah.
So
yeah. Now listen.
Madam Chair, on that point, the project we proposed, we gave a example of a standard, and we constructed it on island that was, arguably significant, would be challenging for the HDC to approve because you have those black edges. The project we proposed had a black roof with black panels and skins matching the outline of the roof. So we met the standard that the HDC laid out in that regard.
I'm confused. I thought that the proposal was actually a gray roof with black panels with then the skins placed on top.
No, that was already approved.
Okay, Kathy, did you have
Yeah, Kathy.
Yeah, there is in the minutes, I don't know what page it's on, but there was a discussion. They thought that the roof was black, and then it was determined it might be like a dark gray.
Oh, that's right.
So yeah, so that was in I think the first go around in July, either July 6th or the 3rd of August, Tim, I can't remember what, but they had a brief discussion about that. That was considered.
Madam Chair, on behalf of the homeowner.
Yes, Wesley.
Yes, Mr. Pohl's example is clearly ugly because it doesn't cover the entire roof. If you look at the proposal from ActSmart, it covers the entire roof, and it is in no way comparable to his example there. Now, My wife is willing to pay the additional cost. The MIT people invented these things. They developed them. She's willing to incur the additional cost to have the skins put on. They are going to be somewhat less effective. The panels are going to be somewhat less effective over the years as a result of the skins being on. Nevertheless, we've gone over and above to try to satisfy the HDC to make these blend in. I urge the select board to look at the proposed, the one X-Smart's proposal for this particular roof, not the other examples, not any of the other, for this particular roof. And you'll find that you have to take a really good look at it to see that there are solar panels up there. Thank you, Madam Chair.
Valerie Oliver and then Kathy.
Oh.
Val, you had your hand up.
Oh.
Did you?
I did before. I will just say I'm going to stick to our guidelines, whether people like them or not. It has to do with it being on the front facade of the main mass of the structure. And in this case, it's a second floor mass. It's not a one-story mass like a cape, which clearly we've found is a mistake to approve them on, because the people who were approved with that, with the caveat that they would screen, did not screen. So, you know, dormers with shallower roofs, that's acceptable, but flat on, eve facing, 2-story eaves without any mitigation efforts whatsoever, it's a mistake. And we're trying to be consistent.
Kathy Flynn?
Yes, sorry, Madam Chair, through you. The skins, as they were requested to be put on the roof, were requested by a few of the commissioners, but also they wanted information from town council if they were to move forward, what the ramifications would be for the board if they were to fail, if they were to fade. So there was more discussion, but they never got a chance to view the solar skins on 9 Dennis Drive. So they didn't move forward with that, but I just wanted to bring that point across. They were concerned about, you know, how it would weather and if it peeled off, what the ramifications for the HDC would be down the road.
Thank you. I don't see any other hands raised. I think that it's time for us to close the public hearing and for the board to discuss and move to a vote. I'm going to close the public hearing. Are there board thoughts? Matt?
Just clarification, I guess, from George, Mr. Pucci. Mr. Morris was saying that we always work under usual, it can't be capricious or whimsical, but he said it's also unreasonable. Would you explain whether that is the criteria we should be working under or not?
Through you, Madam Chair, good evening. George Pucci from Town Council's office. Nice to see you all tonight. In answer to Select Board Member Fee's question, you know, they use a few words: arbitrary and capricious, unreasonable, untenable. Then you get a mix in that says the meaning of arbitrary and capricious is, or something that is not arbitrary and capricious, is such evidence as a reasonable mind would deem worthy to, you know, justify the decision. So all those standards are very similar: unreasonable, arbitrary, and capricious. What I would recommend you do is not get hung up on the specific definition of, you know, how far does unreasonable go? When does that become arbitrary and capricious? They're basically very similar standards. And what it really comes down to is, number one, if the commission was legally untenable, if they applied some standard that had nothing to do with their jurisdiction, that would be something grounds to overturn them. Or if there's no evidence in the record that a reasonable person could deem sufficient to justify their denial. And so that's really what it's about. All of the concerns that were raised tonight, really by both sides, were valid. The main focus, there are two things. Number one, they have solar guidelines, which they should be commended. They're one of the first commissions to even enact something like that. Now, the solar guidelines are not controlling legal authority, but they are something that you could look at. They're defined. And if you found that their decision was way outside of those guidelines, that would be a basis for saying that they're unreasonable or arbitrary and capricious. On the other hand, you know, the converse is if it's consistent with those guidelines, there's a means of finding that then there's a rational basis for the decision. And then the other part that is really relevant to the commission's decision-making in this, and it's right out of your special legislation, and this also goes to Jason and I think Christie's earlier questions about, well, what are you really trying to apply? Does commercial versus residential matter or anything like that? It really isn't a distinction between commercial and residential. It's the context of this structure in its surroundings. So, you know, the statute talks specifically, they shall consider the general design, arrangement, texture of the structure in question, and then similar features of buildings and structures in the immediate surroundings, and the position of such building or structure in relation to the street or public way or to other buildings and structures. So you see there, you know, you can see kind of a rationale for their decision making there in terms of setting. Setting both with regard to the setting on which this particular structure is situated and the exterior feature in question, where that's situated in terms of the neighborhood, and then also context of the lot in question. Where is the exterior feature located on that particular lot? And is that appropriate under those circumstances? So those are the types of things that they're looking at here.
Right. Don, can I follow up?
Yes, Matt, please.
And all those issues, George, we were always operating under the assumption that we can't really insert our own, you know, sort of our own taste in those decisions. Did they do it? You know, did they look at this, you know, properly or not is sort of the standard that we've been using. Question I have is what exposure, if we support the HDC, what risk or what exposure does the town have with the two, Section 7, Article 40C, with the two state laws? You know, do we have any exposure, any risk if that happens? If they, you know, if we support the HDC and they take this further?
Yeah, no, they're not controlling. Your 40C, the town does not go under. That's the state statute for historic districts. That has a lot of the same provisions that your special legislation has, but you have special legislation, one of the, I think the first in the Commonwealth. That's what governs you, not 40C. The zoning exemptions and things like that, those also do not apply. And that's not to say that, you know, the applicant or the appellant was, you know, out of line in citing that type of thing, because they're trying to give you persuasive authority. So certainly you could find other guidelines as persuasive authority, but your governing authority here is the special legislation that governs the historic district committee, and also because they enacted it, you know, those solar guidelines do have some relevance.
If I may, Madam Chair, as a matter of law.
Actually, I've closed the public hearing.
With the applicant.
I've closed the public.
If I may respond to counsel on the
George?
legality.
George, is that okay after closing the public hearing?
Not really, but I think we can err on this. If it's going to be just a limited comment on the law, I think.
Yeah. Thank you, Judge. Yeah, I agree that Nantucket had its own generation, its own private statutes relative to the HDC. But I'm going to give you a quick cite if you got a pencil handy. The Gumley case, I know you're familiar with it. 371 Mass 718. And the first two sentences. Questions are this is the SJC. Questions are presented under the statute establishing a historic Nantucket district, statute 1970, chapter 395, as amended by 72, chapter 708, the statute. We read the statute in the light of the more general statutes providing for zoning, general law, chapter 48, and for historic districts, general law, chapter 40C. In other words, 40C, section 7 does, as a matter of law articulated by the HDC, apply to Nantucket historic districts. This is the case is Gumley versus Board of Selectmen of, oh my goodness, Nantucket. So it does apply. I've heard the rumor all over this island that HDC, we have our own law, the 40C doesn't apply. It does apply as articulated by the Supreme Judicial Court. I would ask you to take a look. Thank you, Council.
Yeah. Madam Chair, yeah, we know about the Gumley case.
Yes.
We've cited it to you on many occasions over the last 11 years that I've been coming before you. But what I said, and I still say it, is 40C is not governing. It can be cited, and that's why I said they're not out of line for citing it.
It's persuasive.
Let me finish.
It's persuasive through the chair.
Let me finish.
Sure.
It can be cited, as I said before, as some type of persuasive argument. It is not governing. What is governing for Nantucket is the special legislation that you have in place, and that's the end of the story on that. So I would in fact cut off any further public comment from there, because we're well aware of the applicable law.
Thank you, George. I guess I'm just going to jump in and say, Melissa, go ahead. I'll let you go first.
Go ahead, Dawn. That's fine.
I mean, I was on the HDC when the solar guidelines were enacted. I mean, we were definitely at an earlier stage in kind of the movement towards the better solar technology, and I think it was really good to enact those guidelines. I think that maybe it is time to revisit additional guidelines based on new technologies and just the sheer necessity of having to embrace solar. And think of it in context with some other things that are kind of obsolete now, like big satellite dishes on roofs and big antennas that I grew up with before we had cable, those kind of things. But and I do feel in this case, the HDC did very much support their decision, as they are always very careful about doing, and used the guidelines. I do think that there is an opportunity for this applicant to potentially revisit this and do some mitigation based on this discussion, but that's obviously something that would need to go back to the HDC and be thought through. I don't think that we really have the ability to remand it. But I would love to see that maybe they figure out a way to revisit it and do some trees or different color scheme, so forth, maybe something a little bit smaller. Those are the kind of opportunities I think might be available. And I would, I guess, turn it over to Melissa. Those are my basic thoughts. And then you, Christy.
I agree with everything that you said, and some of the notes that I've taken through this debate is that environmental leadership is one of our strategic plan goals as a board, but also as a community, because those goals are reflective of what the community wants us to focus on. And I think it's really critically important that all town agencies start to review some of their policies, like these guidelines for a review of solar panels, to make sure that we're all moving in the right direction. And so I agree with you that it's probably time to have a work group revisit those. I do think that the HDC was not arbitrary or capricious in this decision, but I am disappointed in the outcome, because I do think that now that solar energy is becoming more accessible to everybody, that we're going to start to see, exactly as somebody said earlier, and I'm sorry, I don't remember who, we're going to start to see more of these applications coming in. I'm a neighbor of Dennis Drive. I live across the way on Alexandria, and I'd love to put solar panels on my house, but you could see them from the street. We don't have the benefit of a lot of tree coverage in the Mid-Island area, particularly because the way that we've been allowed to develop those areas. So I really strongly encourage the HGC to take into consideration how our neighborhoods have been zoned and planned and built, and see if there's a way that the average Nantucket homeowner can take advantage of this technology. I also just want to add that I think by doing so, we may also be able to stave off this third cable that keeps haunting us as a threat. But the reality is, every home on Nantucket is using far more electric energy now than probably ever before. And we've got to have all of our agencies back our play on showing environmental leadership. And so I appreciate this debate tonight. I do also encourage the applicant to see if there's a way to work within the HDC guidelines, but I also encourage the HDC to take a look at those guidelines and see if we can't come up with a more current solution or current guidelines. Thanks.
Christy?
Thank you. Just a couple of notes. I agree with you, both Dawn and Melissa, that reviewing both the HDC guidelines and also having everybody, refer back to the strategic plan helps the town and all of its agencies move towards what we see as the future of Nantucket. A couple of things. I was frustrated or disappointed by the minutes of the HDC in which it was basically proposed to deny it just for it to go to the appeals process, because I think it's very clear that, select board is kind of, our hands are tied in the trying to find the arbitrary and capricious findings. And, we can disagree with the HDC, but that's not what we're charged with doing in this appeals process. And so I think it brought up a healthy debate of how we can kind of change the guidelines, or maybe how the applicant could change their application to get it approved. But kind of the proposal to just go straight to a denial, just to go to the appeals process, doesn't seem like the best approach for town policies, to not try to work towards a middle ground. Another thing is just, I know that the HDC is focused on keeping Nantucket a historic landmark, and I think we're missing the big picture, that in 50, 75, 100 years, we're not going to have that if we don't focus on the solar energy and renewable energies. And if we, if you look at the first line or so of the guidelines, it says to look at all other aspects of reducing energy consumption before going to solar panels. And I think it has to be like, how do we do all of these things? Because we need to be focusing on the sustainable future of all of the homes on Nantucket, and making sure that we keep Nantucket, this unique place that we all love and enjoy living here, but making sure that it's still here in 7,500 years from now, and focusing on that sustainability. So I just think we need to review these guidelines. And, it was said a couple times tonight that you made a mistake on a prior home. And I think this might be a mistake, not having more solar panels today, and that we'll be regretting it for years to come. So thank you.
Jason?
Thank you, Madam Chair. I think I've done 8 or 10 of these HGC appeals in my time on the select board, and every one of them, it never really got close to arbitrary capricious. Even if I, agreed with or disagreed with the HGC, this one I'm close. Arbitrary and capricious it's a high bar, and I don't think it's there. I think you could disagree with the decisions, but I think it was thought through and there's reasoning behind it. So I either don't understand the reasoning or I disagree with it. Or maybe I need to understand the guidelines a little more. It seems a little, it's not arbitrary, capricious level, but I feel like this is close. And so I agree with looking back at the guidelines, which has nothing to do with our decision right now. I do want to throw out there for the record that I would be happy to put time into pushing that from a policy standpoint. Thanks.
Matt?
Yeah, I'm with Jason a bit on this. It's pushing it. And I would love to see these on this building. I think that they would. I don't like the skins at all. You know, here I am talking about things we can't talk about. I'm going to support the HDC, but it's killing me to do so. It's absolutely killing me. I think that this is I think that it's covering the whole roof. It's dark. All the neighbors are in agreement. It's facing the right direction. You know, this is a roof that we should be putting solar panels on. And so, you know, but I'm supporting them, but I'm with Jason. It's really close. And if I could find a way to not, I might not. But I think the other thing is we have to realize once they go up, they're dark. You don't see them. It's not the end of the world. I love Don's description of the large antennas when we were kids. You know, I didn't think Don was old enough to remember that, but it's, it was crazy some of the things we lived through. And I think that we get a few years out, we're going to look around the island and these are going to be normal. What Christy's talking about, saving energy and doing this, we have to do both is, absolutely 100% correct. And I think that's, so I'm going to support them, if we remanded it, or if, one of the questions I had, I think it was answered is, had they done a mock-up, would we, if they had done a mock-up, would there have been a chance it would have passed? Perhaps it would have. I'm not a big proponent of the skins because I think the solar panels themselves, they're dark black, they're neutral, they don't look badly. When you see them, you look up, you see them once or twice, you never notice them again. I think the guidelines need to be changed. Some of the guidelines are asking for solar panels to be on arrays on the ground as a first choice. I think they're terrible as an array on the ground. Their roofs are a perfect place to put them. And so, when you put them on the ground, you see them even more strongly. And so I just think that, again, I think we've got some work to do on those guidelines. I think they look a little silly in between the sort of only a couple on a roof. I think a full roof full of them, I think looks great. And I know that the HCC has done a good job of doing that on a lot of projects. But I just sort of think, how do we move from here?
Warrant's open.
I think the real consensus tonight is, and we'll go to a motion, is that the HDC did not act in an arbitrary and capricious manner, but that we are all struggling with the conflict here between the HDC's review of solar panels and I think we all see the necessity to move towards more solar technology in a thoughtful way. So does someone want to make a motion?
Or do I have to be more specific? Would you like me to be more specific, Dawn?
I can help with that.
Erica, thank you.
So the motion would be to deny the appeal and uphold the decision of the HDC.
Wonderful. I'll make a motion to deny the appeal and uphold the HDC decision.
Is there a second?
Second.
Thank you. All those in favor by roll call, Jason Bridges.
Hang on, Don, before we get there, is there any appetite for a remand? Does anyone see any point in remanding?
I'll go to you in 1 second, Christy. I think that the applicant can willingly go back with alternatives. I don't think that it necessarily would come from us in terms of proper reasoning for that. Christy, I feel like a remand is more when an administrative error has been made. Christy?
I think we're all on the same
That
page.
That was my question is kind of what would that look like and how could we push it back? But if the applicant is fine with going back, I don't think it needs to be remanded.
Thanks for speaking up, Tobias, on that. I'm going to go back to that vote. Jason Bridges?
Aye.
Christy Ferrantella?
Aye.
Matt Fee?
Aye.
Melissa Murphy? Don Holgate, aye. Thank you all for your time tonight. I think that this was a really valid discussion to be had, and too bad we only have 7 attendees. Hopefully some people are watching on TV because I think this is a really important topic.
Warrant's still open, Madam Chair.
No, it's not.
I know. Well, for us it is.
For you,
Thank
it
you
is.
everyone for your time.
Thank you, everyone.
Thanks, everyone.
Thank you.
That wraps up the agenda for this evening. Is there a motion to adjourn?
So moved.
Second.
All those in favor by roll call. Everyone is jumping around right now. Jason Bridges.
Aye.
Christy Ferrantella.
Aye.
Matt Fee.
Aye.
Melissa Murphy.
Aye.
Don Holgate, aye. Thank you. Thanks for your time, George, and everyone else.
Thank you very much. Thank you.